Good morning, everyone, and welcome to the final edition of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs. Just before we get started, I want to apologize to everyone who was here on time. We always need a quorum before we get started, and we had a couple of the members who, one didn't have it on his calendar, and the other is still waiting on a flight. But I take these meetings and your time commitment very serious, especially because of the population with whom we are trying to serve. So please forgive us. And it is my prayer that this will not happen again, because I know that your time is precious as well as others. And there are people who have managed to get here from different places to get here to this building on time this morning. And for whatever the reason, we had a couple of members who could not make that happen. And so with that, Madam Secretary, please call the roll.
Senator Dondero Loop.
Here.
Senator Krasner. Vice Chair Brown May.
Here.
Assemblyman De Silva. Assemblyman Gray.
Present, and I send my apologies.
Chair Spearman.
Here. And please mark Assemblyman De Silva present once he arrives. As you know, he is also a public school teacher, and he will be coming from Rancho just as quick as he finishes his last class. So he'll get here in about an hour. So Madam Secretary, please mark him present once he gets here. So before we begin, I'd like to go over a few housekeeping items. Remind everyone to please silence your telephones and all of your electronic devices to make sure that they do not go hum, bum, sing, or anything of that nature while the meeting is going on. For members joining online, please mute your microphones when you're not speaking, but leave your camera on. The committee's meeting materials can be found on the Nevada Legislature's website. You can also sign up for electronic notifications related to any activity on the committee's website. If you wish to testify in person, please sign in at the table by the door and leave a business card. If you do not testify, you may also want to sign in so that there's a record of who is interested in a particular topic, and in the event that the committee needs to contact you later. When testifying in person, please turn the microphones on to speak and speak directly into the microphone. This is very important because we have people who are listening to us online, and if you do not speak into the microphone, they will not be able to hear you. When testifying in person, please turn off the microphones when you are finished. And we have listeners and viewers in Carson City and online who would greatly appreciate you taking note of these instructions and following. We'll have public comment period at the beginning and the end of the meeting, and public comment is limited to 2 minutes per speaker. In addition to testifying in person, members of the public may provide public comment in 4 ways, all of which are listed on the agenda. You can provide public comment by 1, calling 888-475-4499. That's 888-475-4499. Then entering meeting ID 853-1191-1362, and then press pound. You can email comments to seniorvets@awsn@lcb.state.nv.us. Mail written comments to Research, 401 South Carson Street, Carson City, Nevada, 89701, and also by faxing 775-684-6400. You can find the phone and fax numbers and email addresses and mailing addresses on the agenda. We have interpreters available as well as closed captioning services. And so we ask that if you require an interpreter, you stand in front of the dais on the left. Again, we have interpreters as well as closed captioning. And if you require an interpreter, please stand in front of the dais and on the left. With that, let's get started. We'll start with public comment, agenda item number 2. Is there anyone in Las Vegas who would like to provide public comment at this time? Just like to remind everyone, during public comment, we do not ask questions, nor do we make comment. comments, it is an opportunity for the public to express things that may be on their heart at a different time that those subjects may or may not come up. But during public comment, we don't make comments or we don't ask questions. With that, let's proceed.
Good morning. My name is Eli Schwartz. I am a member of the Nevada Commission for the Person who are Deaf and Hard of Hearing. I had the pleasure of working with Spearman in May of the past. You had asked for the deaf community to show up. We did. We're serious about what we need with our community. However, I'm also representing the legislative subcommittee for the commission. And I'm here personally asking for 3 BDRs, if all possible, for the next session. We would like to get back into creating a deaf school, which I know Senator Spearman is passionate about. We want to make ASL as a accredited class in high school and college. So instead of having a foreign language like Latin, French, they could take ASL. Maybe that would spread awareness of the ASL language. And we want to work on closed captioning in the public places, such as hospital, doctor's office, legal, like I said, medical. So we're working on that. Again, I am looking for 3 BTRs, and so we can make this great state of Nevada a very accessible state. Thank you.
Morning, Madam Chair, members of the committee. My name is Nate Boyack. I am a representative of the State of Nevada Association of Providers, and I'm on the executive committee. I'm also the executive director of Bringing About Independence, which is a residential provider that provides support for people with developmental disabilities in the community. And I just appreciate your time today and your service, and I also appreciate you working on item number 7, which is a BDR that would allow for agencies to not be discriminated against when seeking housing, public housing, not public housing, but rental housing with apartments and rental properties for people with intellectual disabilities. We've had significant issues over the past many years, both in northern and southern Nevada, finding housing and having landlords and management companies accept our applications on behalf of people with intellectual disabilities. And we appreciate your work and your consideration on this issue. Thank you so much.
Thank you. Broadcast, do we have anyone on the phones?
Thank you. To provide public comment, please press *9 or raise hand in your Zoom window to take your place in the queue. Again, if you wish to provide public comment, please press *9 or raise hand on your Zoom window to take your place in the queue.
Thank you. Broadcast, do we have anyone on the phone?
Caller, you're unmuted. Please go ahead.
To provide public comment, please press *9 or raise hand in your Zoom window to take your place in the queue. Again, if you wish to provide public comment, please press *9 or raise hand.
Caller, if you have the meeting playing in the background, can you please mute it?
Oh, yes. Okay.
Please go ahead.
Yes, I would like to make a comment on the 80/20 Medicaid access rule. It is important to understand that this rule will not only affect providers who accept Medicaid, but has broader implications for smaller providers and those in the private pay sector. I work for an organization that has a small PCA program, and along with many smaller providers, we try to keep our hourly rates for clients as low as possible. We fear that the increased labor costs will force us to raise our rates, potentially making services unaffordable for many clients. This could disproportionately affect vulnerable populations who rely on these services, leading to reduction in available care and possibly resulting in the closure of some care organizations. It is a complex issue where the balance between fair worker compensation and the affordability of care for clients is delicate and requires careful consideration by policymakers to mitigate the unintended consequences of creating less work for PCAs and fewer providers to choose. Thank you.
Hello, could you all hear me okay?
The closure of some care organizations. It is a complex issue where the balance between fair worker compensation and the affordability of care for clients is delicate and requires careful consideration by policymakers to mitigate the unintended consequences of creating less.
Caller, are you able to?
closure of some
Yes, we
care
can hear you, caller. Can you please mute the
It is
meeting
a
on your end? We can
complex
hear the meeting.
issue Where the balance between fair worker compensation and the affordability of care for clients is delicate and requires careful
Broadcast,
consideration
just
by
mute them until that
policymakers
goes off.
to
Mute
mitigate
the
the
caller.
unintended consequences of creating less.
Caller, are you able to?
Hello?
Yes, we can hear you. Can you please mute the meeting on your end? We can hear the meeting.
Where the balance between fair worker compensation and the affordability of care for clients is delicate and requires careful
Broadcast,
consideration
just
by
mute them until that
policymakers
goes off.
to
Mute
mitigate
the
the
caller.
unintended consequences of creating less.
Caller, are you able to? Yes, 1 second. Can you please mute the meeting on your end? We can hear the meeting.
Where the balance between fair worker compensation and the affordability of care for clients is delicate and requires careful
Broadcast,
consideration
just
by
mute.
creating less.
Yes, 1 second. Can you please mute the meeting on your end? We can hear the meeting.
Where the balance between fair worker compensation and the affordability of care for clients is delicate and requires careful
Broadcast,
consideration
just
by
mute.
creating less.
Yes, 1 second.
Broadcast will come back down here to Las Vegas, and in the future, anyone who is online and waiting to speak, we would ask that you would mute your computer or whatever device you're listening to before you open the phone line to speak. Otherwise, if that happens again, we'll have to push you to the public comment section at the end of the meeting, okay? So we'll come back here to Las Vegas, and I don't think I see anyone up north, but Las Vegas, public comment.
Thank you, everyone. My name is Anna Marie Binder. I am a appointed member to our Nevada Governor's Council for Developmental Disabilities, as well as our Commission on Autism Spectrum Disorder. Although I'm here individually, I really like the materials that are on your agenda today, especially with the inclusion of the Olmstead for our older and vulnerable population. As many know, I have this year had to take guardianship of my veteran 94-year-old grandfather, who is also deaf and hard of hearing, and have now experienced the Nevada route that is provided. And it's been fairly easy for us, but obviously I have to continuously take in our community feedback and issues that everyone is having. And I'd like to concur with a previous public commenter, because over the last couple of years, the Governor's Council on Developmental Disabilities, we get a very small community grant fund for a program called ASL Anywhere through Global Technical Communications. And each fiscal year, we've only been able to allocate approximately $30,000 to this program on an annual basis. And the feedback that we get from the users is it's predominantly used for their medical appointments. And I know that I have advocated a lot over the last couple of years that any extra dime we have that we push over to this grant, because I couldn't imagine being in a doctor's office and only getting to speak with, most of the time, the receptionist before my minutes run out. And so I would ask that as we come into the next session, if there's any allocation of funding that the state can help provide to this technology, especially for medical appointments for our deaf and hard of hearing community, it would be instrumental in their health and well-being as they seek services to live the best life that they can in our state. Thank you.
We'll go now to Carson City. I understand there's someone in Carson City, and then we'll come back to the phones.
Hello, everybody. My name is Catherine Nielsen. Typically, I am here representing the Nevada Governor's Council on Developmental Disabilities as their executive director. However, today I took annual leave so that I can be here to support the community as well. We did attempt to secure interpreters through the accessibility team, so I do want to make note that they did a really great job, especially because I know they're kind of new at all of the accessibility piece, but they were unable to secure interpreters for the North. So we did bring interpreters with us today. Thank their hearts for being available. We just wanted to highlight that it is extremely difficult for those who are deaf and hard of hearing to get access to interpreters and their information in American Sign Language. And so as we do our best to try to fill in the blanks, just wanted to remind you that we are all wearing shirts today that say #NothingWithoutUs. Not just the deaf community, but the disability community as a whole wants to remind you that we are the largest minority group out there, and that every single person in all of these rooms are all 1 second away from being a part of this group as well. So we are gonna be supportive for you all, and we're here to be support if you guys need anything, but we will continue to keep showing up and be supportive of the legislature. So thank you so much.
Hello, everyone. This is Betty Hammond, for the record. I am retired from some of the programs I'm going to be speaking about, so I'm just for full clarity here. I am retired from the state, and I'm a certified sign language interpreter nationally. Not all registered interpreters are also certified. And you know, our deaf center that we used to have was a work in progress, but it was a stopgap. It was a way that the FCC money and the PUC money could be used to serve the community so that the whole state of Nevada didn't look like what they look like. And I'm going to tell you, as lawmakers, the ADA, IDEA, NRS 427A.100, laws that are national, FCC, Lead K for deaf children 0 to 5, all these things are in law and not being followed correctly. With the state of Nevada, we failed as a whole to provide, enforce, or educate community about the Americans with Disabilities Act. There's no deaf school here. I spoke to you before, Senator Spearman, about no deaf school in Nevada. That's still a problem. We used to have deaf centers, the NNCIL, Northern Nevada Center for Independent Living, Deaf and Hard of Hearing Advocacy Resource Center after that, Deaf Centers of Nevada after that. Now there's a major lack in services, and people don't know what to do with it. But this is not hyperbole. There are deaf people out there with medical issues that have no advocacy. And if your answer is to go look on a website, many of them, because the state has failed to educate them from 0 to 3, they don't know how to read effectively. So if you think closed captioning or something printed is going to help the people that need it the most, that is an error. It's an error that a lot of people make. So thank you for your time.
My name is Rachel Daly.
We'll take one more in. Please proceed. One more in Carson City, and then we'll come back down to Las Vegas.
My name is Rachel Daly. I am a 26-year-old woman with autism, and I receive services from Sierra Regional Center. However, I've been having some problems with them. SRC once changed my plan without my consent, and I don't believe I've ever received all my services from Sierra Regional Center. There were multiple times when my provider would cancel on me with no notice whatsoever, and I'd be crying because I'd miss important appointments or events. And because of their failure to provide assistance with medication, I took the wrong medication once and experienced side effects. And when I asked, they said they do not know when I will get all my services. There's no criteria for when a provider will help me. I was told providers will only help me if they feel like taking my case. The supervisor once told me there's no wait list for receiving services. I may be disabled, but I'm not stupid. I have a bachelor's degree from UNR. Please help me become self-sufficient and contribute to Nevada. And help me and other people with disabilities get our services soon. Really bad things can happen when we don't get them. Thank you.
Come back down to Las Vegas.
Hello, everyone. My name is Shelley Freed, and I'm with the Las Vegas Deaf Seniors, and I am here today to talk about NRS 65A as well as the NRS related to communication access services that has failed the deaf community as a whole. Not only has the Deaf Center no longer here, other services that should be provided for us and resources are not easy to navigate. I'm here with a list of items I'd like to discuss with the legislative offices 4 through 8, specifically talking about the assistance of services, online BDR, auditory aids. They don't recognize us as part of the community when they've developed that BDR. Thank you.
We'll go back up to Carson City.
My name is Sarah Mahler, 27-year resident of Washoe County. Thank you for this opportunity to speak today on the need for people with disabilities to receive services they are entitled to here in Nevada. My young adult daughter is on the autism spectrum. She has qualified for services through Sierra Regional Center for years, and to date, the only service she receives is $125 a month toward respite services. We have worked with a service coordinator at Sierra Regional Center to understand what services she qualifies for and how to obtain them. Still, the whole process has been confusing and more challenging to navigate than necessary. I have asked for information on how they rate vendors, who the vendors are, and how much the state will pay towards housing and other services. I'm still confused and my questions have not been answered. I'm a very dedicated parent, and this process has been of trying to obtain services through Sierra Regional Center has been aggravating and non-transparent. I'm hoping your committee can address the need for young adults on the autism spectrum to receive services in a timely and transparent manner. Currently, we are very frustrated and disappointed at the lack of services available for young adults on the autism spectrum. Thank you.
My name is Alan Ward. I'm the owner of Home Instead, a personal care agency in Northern Nevada. I'm also the president of our statewide association, Personal Care Association of Nevada, PCAN. We're here today to bring awareness to a growing crisis in our state and around the globe, caregiver shortage to meet the care needs of our rapidly growing elderly and infirm population. Nevada is one of the fastest growing populations of senior population in the country. Even before the Great Resignation, we were challenged in recruiting, developing, and retaining enough caregivers to meet the need of our community. You could argue that every industry has a labor shortage at every level, but the consequences of being understaffed in retail, fulfillment, manufacturing may mean longer lines, slower service, or delayed packages. However, understaffing in home care means someone is going without a shower, a meal, or even medications. And these consequences lead to otherwise avoidable emergency room visits, hospitalizations, hospitalization admissions that place unnecessary burdens on our already overtaxed healthcare system. And of course, we need much more selective in hiring caregivers as they are entrusted to be in our homes caring for our most valuable population. Although home care is not reimbursable with Medicare, like hospitals, rehabs, home health, or hospice, it is the mortar throughout the foundation of the continuum of care from the beginning in assistance with ADLs to the end of life with hospice, and often plays a preventative role, avoiding more costly acute care settings and rehospitalizations. Personal care agencies are not regional or national corporations. They are small business owners. Some are in franchise models, some independent owners, but the profit margins don't interest the big, large companies. And one of the main reasons that our services are private payer or Medicaid, our greatest challenge is to balance the wages, benefits, and investment that will attract and retrain reliable, trustworthy, compassionate care professionals with affordable hourly rate to our fixed income seniors and their families. These essential services can be limited to the poor person or to the rich person. They need to be available to all persons. Our mission is to reduce what lies between us, the ever-increasing regulations, license fees, PTO contributions, workers' compensation, unemployment, modified business tax, general liability insurance, health insurance, just to name a few. I've been in the business for 19 years. Every 2 years, we have additional regulations, burdens, but never have them reduced. We're up here to give you, we're basically here, and you'll hear a presentation in the coming period by Bob Crockett. We have a few proposals that will help us reduce that. One of which is to eliminate the regulations that are obsolete and are unnecessary, onerous, thereby limiting the economic potential of the state. Create a regulatory environment that will be concise, transparent, stable, balanced, predictable throughout, and thoughtfully constructed. One of which is addressing the 8-hour day on a 24-hour rolling clock. We are the only state in the nation. To provide a waiver for home care because we are a 24/7 type of business, the 8-hour day on a...
Excuse me, sir?
Yes.
Excuse me, sir. Can you wrap it up? You're just over the 2 minutes. Can you wrap it up, please?
Yes, I can.
Thank you.
The other key point is to extract PCAs, a non-medical provider, out of facilities for the dependent, which is a clinical and facility-based. PCAs are not facilities. We do not house our clients or patients. They are administrative offices, and we send our caregivers into the homes or residents. And as such, should not be regulated like we serve a consumer in a brick and mortar facility.
Thank you, sir. I'm going to ask if you submit the rest of that in writing, please. Thank you. We're going to come back down to Las Vegas and want to remind everyone that we're limiting public comment to 2 minutes per person. If someone has already said what you want to say, it's okay to say ditto. And anyone who is not able to complete their entire testimony audio, then you can submit that and we will make that a matter of record. So back down here to Las Vegas.
Good morning. My name is Jamie Vitale. I'm a member of this community, and I'm on the Commission for Individuals who are Deaf and Hard of Hearing. And I'm also here for Las Vegas Deaf Seniors. Thank you for having me here, and thank you for allowing us to be here. From my experience and from what I hear from the community and the exposure that I have, when we go to a hospital, when we go to a doctor's appointment, there's not enough sign language interpreters. There's a lack of access, especially if it's something that's last minute or an emergency. We wait 2-3 hours, and even when something is provided, it's video remote interpreting, and because of the internet connection, we can't get the services we need, and there's just a huge shortage. And so if something were to happen to us in a medical setting, we could sue because we need access to communication. And when it comes to doctor's appointments, they will cancel them because they won't get an interpreter, which means our health is severely impacted. So the scarcity of services that the state of Nevada has, the lack of interpreters, is really terrible for our community. So I hope that you can do something to provide hospitals with full-time services, interpreters, staff interpreters, so that they're already there when there's a need, and not using internet-based services when those services don't work. We don't have connectivity. And there are some who have a low level of communication and don't have the access to language. So we really need that. So thank you for your time today.
Thank you. We'll go back up to Carson City now.
My name is Larry Daly, and I'm Rachel Daly's father. As Rachel said, she and her advocates are repeatedly told that her services cannot be delivered and that there's no process to even tell her when they might be delivered. With the full blessing of the ADSD, service providers accept or deny cases arbitrarily. ADSD says providers can refuse to take cases, and this is a quote, for any reason. I asked the administrator and a deputy administrator what any reason means. If, for example, a provider just wanted to take easy cases with a certain disability, would that qualify as any reason? They said yes. I pressed further, being a little shocked by that, asking if providers could refuse cases because they were uncomfortable working with Black people. A deputy administrator, in the presence of her supervisor, replied, and this is a quote, technically, yes. I'll take a lie detector test on this if you want. When Rachel filed an internal ADA complaint, the ADSD ADA coordinator, in a bathroom break, told Rachel and me that we were right about everything, but that her findings would not reflect that we were right about everything because she had, quote, a baby and a dog to feed, end quote. She did not want to lose her job through retaliation. Since that time, the Federal Health and Human Services Office of Civil Rights has found that ADSD is likely discriminating against Rachel, who testified earlier today. The feds are supposedly providing technical assistance to ADSD. We don't see a difference. ADSD does not seem capable of understanding the mandates of complying with and teaching the ADA, let alone reporting that information reliable to committees like this one. They seem to not understand that any reason means any legal reason. My daughter's life, as I discussed at your last meeting, might be in your hands. You met her today. I hope you love her as much as I do. Please help her and people like her get the services they need and end the discrimination of they can deny you services for any reason. Thank you.
Good morning, everybody. Madam Chair, I'm Connie McMullen, representing the Personal Care Association on item 2 in your work session. Nevada's statute 427A.029 for the frail elder was established in 1987 to enable the frail elderly person with a physical or mental limitation to live independently and carry out normal daily living. Nevada's waiver for the frail elderly, 1915C, was approved in 1992, but it was approved without nutrition or attendant care. During the pandemic emergency assistance period, funding for nutrition was approved for adults who did not have that service. Since the funding has been discontinued, it is obvious that there is a need and a desire for that funding to continue in our state. It makes good sense to expand the frail elderly waiver to include nutrition assistance for vulnerable seniors and attendant care to enable low-income adults to live in their home. Adding these services to the waiver would bring consistency and comparable access, facilitating independence and self-sufficiency for people to live alone. PCAN additionally favors creating a caregiver portal listing providers, services, level of care, verified complaints, and other information. Today, consumers must call several providers regarding services, communities served, and the cost. A portal on the state website would greatly minimize time spent, duplication, cost of finding decent caregivers, and assistance. Additionally, we also want to express our deep concerns about the Medicaid access rule and the difficulty for PCAs currently to deliver quality service and remain in business. We ask that you give serious consideration to item number 6. We thank you for your time today and your interest in building a more robust set of home and community-based waivers for services for people living with disabilities and their desire to live in a least restrictive setting. Thank you.
We'll come back down to Las Vegas.
Good morning. My name is Sean Mulholland, and I am the president of Las Vegas Deaf Seniors. I'm here to talk about hospital medical access, and thank you, first of all, for having me here, for inviting me to be part of this. I just want to say that I have seen many of our community members start to grow old, to have medical care more often, and the state of Nevada has gotten even worse when it comes to providing interpreting services in hospitals and doctor's office. They provide VRI, video remote interpreting, which is an internet-based service. And we have reached out, we have tried to do what we can, but we unfortunately come across people who ignore the current laws, ADA, and other things that are already in place. We've had deaf people in the hospital 3 to 5 days with no access to communication, no interpreter provided. They've been given written instructions, and sometimes when it comes to written instructions, the language is too complicated for the patient to understand. The deaf person's access to written language. Bringing in an interpreter gives clarity to the situation, gives access to communication, and I feel like we need to protect the senior citizens in our community. And to give you an example of that, in Rochester, New York, they have sign language interpreters that are ready at the facility. They provide VRI services as well. Minnesota also has sign language interpreters ready at their hospitals, and South Dakota also has those services. They have sign language interpreters ready. They have access to communication. Here in the state of Nevada, I feel like we're in last place when it comes to comparing us to every other state. We need your help we need the senators, we need the assemblymen, we need your help. Please help us to wake up the rest of the medical community in the facility so that as the community grows and as we have more deaf people that need access, that we have services that we need. And without a deaf center, we can't access resources. And it's very sad for us, but we want you to listen to us. We want you to think about what it is that we need for our future. Thank you so much.
She has a microphone, so she'll just still speak from there.
Okay, so
yes. Would you like me to sit, Senator, or what would be your
yeah, can you stand in the frame with them?
We want you to stay in the frame, and then the witness will go to the witness table, and then you could just speak in the.
Yeah.
So you're still in the PI.
So they're flipping. He's doing American Sign Language, which is what's in the frame, and she's speaking. That's why they're.
Is it okay though that he still looks at me because I need to see him to voice?
Okay.
Yes.
Hold on just a minute. Hold on just a minute. Hold on.
Is that what you're requesting, Charlie?
No, hold on just a minute. So yeah, I'm trying to figure out what's going on here. So yeah, I think while we had him standing there so that he could be in the frame and people could see. Okay, all right. So let's reverse it. We'll go back to where we were. Okay, sorry about that.
Thank you. No problem.
New building, new techniques. So please forgive us.
Good morning. My name is Matt Robinson. Before I begin, thank you for your time. Thank you for having me. Specifically, the reason I wanted to come here today was just to share one fact. And there's no offense to the interpreter that's voicing for me at this time, and there will be none taken, so don't worry. The point is, where are the state interpreters? Why is this interpreter here? This interpreter is from ASLCOM. She is from some agency. The state of Nevada has paid ASLCOM so much money to provide interpreters. We have state interpreters. Where are they? There are 5 interpreters. And I don't see them here. I'm looking around the room, don't see any sign language interpreters. You have invested this money into them, and now you're paying ASLCOM. You are wasting money paying for this interpreter when you've already paid for staff interpreters for the state. One interpreter. Why not one state interpreter, one ASLCOM interpreter? Hats off to you. At least you'd use one of them. But you have none of them here. They were all busy today. It does not make any sense. That's all I have to say. Thank you for your time.
Thank you. Let's go back up to Carson City and broadcast. Don't know if there's anyone on the lines, but after we finish with Carson City, we'll come back to the phones. And just like to remind those who are on the phones, please mute whatever device you are listening to or looking at before you start to engage us in conversation. So Carson City, let's go.
Thank you so much, Chair Spearman and members of the committee, for the opportunity to address you. My name is Eric Wilcox. I'm the parent of a deaf child, and I'm here today in my role as chair of the Nevada Commission for Persons Who Are Deaf and Hard of Hearing. I had the pleasure of presenting to this committee along with 2 of my colleagues at the April 30 meeting of this committee. And I wish to follow up on one point of discussion, which was alluded to by the previous speaker, as well as provide a brief update from the deaf and hard of hearing community. At the April 30 meeting, there was a discussion about accessibility of legislative hearings for deaf individuals. And while we at the Commission are always happy to help the legislature and any other state agency or state entity to understand how to better provide accessibility, I did want to make clear, as the previous speaker mentioned, that NRS 427A does provide for a team of sign language interpreters specifically tasked with providing accessibility for deaf individuals to state agencies and the legislature. They have in the past consulted with the LCB on accessibility of legislative hearings, and they've expressed to the Commission a commitment to continue to do so. Regarding the accessibility of the April 30 meeting of this committee, we did want to make you aware that the remote interpreters who were providing sign language interpreting on the live video feed and the recording of that live video feed were not consistently viewable on the screen, either in the hearing room or on the recording. Furthermore, my 2 colleagues, Obioma Officer, the Executive Director of the Deaf Commission, and Shelley Freed of the Las Vegas Deaf Seniors, who presented testimony in American Sign Language, were not consistently visible on the screen or in the archived recording. The Commission followed up with the LCB. We're committed to helping as best we can to improve accessibility, and I do want to acknowledge and thank you for the effort that went into providing accessibility at today's hearing. And we encourage the LCB to avail themselves in the future of the state interpreting team. They are your expert team to provide comprehensive accessibility. Finally, I just wanted to draw attention, as I'm sure is now clear, that the disability community, as well as representatives from the from our deaf community groups, are assembling today to raise awareness of the ongoing challenges facing this community, many of which have been voiced already today, as well as to organize around a legislative agenda to address these concerns, with which my colleague Eli and others have mentioned elements of in the public comment. The Commission is grateful for the support of legislators on this and other committees for the opportunity to communicate our concerns to you, and we look forward to working with you in the 2025 legislative session on alleviating the persistent challenges faced by deaf and hard of hearing folks in Nevada. Thank you for your time today.
Hey, let's broadcast. Do we have anyone on the phones?
Thank you, Chair. To provide public comment, please press *9 or raise hand on your Zoom window to take your place in the queue. Again, if you wish to provide public comment, please press *9 or raise hand on your Zoom window to take your place in the queue.
And remind them to turn off whatever apparatus they're using to listen to us on so we don't get the same feedback as we did earlier. Thank you.
Caller with the last three digits 653, please press *6 to unmute yourself.
Can you guys hear me okay?
Yes, go ahead.
Okay. Good morning, Chair, Vice Chair, member of the committee. This is Dora Martinez. I'm sorry I couldn't be there with you all in person due to the lack of equitable transportation. The earliest bus that left Reno to Carson was 6:30, and I couldn't make it with my service dog. So I just want to commend and appreciate Catherine Nielsen and Obiyama and everyone who spoke, Obiyama officer, and getting us all together with you all, Madam Chair and Vice, so you could all see us, we could be heard and be seen. I heard from one of the great women of our time that said, and I quote, "When we fight, we win." And let's go do something. So we are doing something, and we hope that our presence will have an impact in your mind when you guys are creating BDRs and bills and laws, that this will impact the most, quote, vulnerable population in our state, unquote. I couldn't really read the items on the agenda. I read the agenda. Agenda is fine. But the materials that were available is not 100% accessible. So I go back to Ms. Director Nielsen's point that when you build accessibility from the bottom up, Madam Chair, it's accessible to all. Some of them are PDF and they're not the accessible, user-friendly for the blind PDF. Because I understand you guys don't want plagiarism, but there is a way to make a PDF read for people with screen readers. And that way we could come to the table with you guys and give you guys constructive feedback. So when you build these laws that will affect people with disability, it makes a positive impact. And I appreciate all that you all do. And I would urge you to look at the YouTube for the Democratic Committee. They had an ASL interpreter and audio description. So this is doable. We can do this. And I appreciate all of your time. And thank you. Have a great session, and I'll be listening in. Thank you, Catherine and Obiyama. Bye-bye.
Chair, we have no additional callers for public comment at this time.
Thank you. Let's come back to Las Vegas.
In Las Vegas, you know, we have the casinos, we have the stadiums, and the football games don't have any captioning. We love football too. We love sports. People from out of state come in, and we want to be able to understand what's going on as well in those things. So we would love to have some kind of cart or captioning provided for the Super Bowl and stuff when it comes. That's all. Thank you.
Thank you. Anyone else in Las Vegas? Do we have anyone up north in Carson City?
Should we go?
Las Vegas?
Thank you. Good morning. My name is Paula Kurowitz, and I'm a member of the Las Vegas Step Seniors, and I also volunteer for the committee access. There's a real live threat at the hospitals without having interpreter services or VRI for 3 days. That's not fair for emergency room visits and such. The reason that Nevada, it advocates for a 15-day grievance, and that's not enough time. We should have 30 to 60 days to go ahead and file those complaints to go ahead and improve that access for the hospital. Again, thank you for your time. Can more go up? Should I wait here? Are you going to the north?
Yeah. Anyone who wants to make public comment here in Las Vegas, if you can just come forward now, and if you don't get a chance to testify in this segment, we will also have public comment at the end of the meeting. So let's take about 3 more, and then we'll close this segment of public comment, and we'll come back at the end of the meeting, okay? So I see 2 people here in Las Vegas. Is there anyone up north? 1, 2, that'll be the 3rd person. Anyone up north? Okay, no one up north. So we've got the last 3 people down here, okay? And we'll come back. We've got another segment at the end of the meeting.
Hello, my name is Lee Bullock. I'm on the board for the Las Vegas Deaf Seniors as well. Again, thank you for allowing me to be here today. My main concern is the huge disparity in healthcare services between the hearing community compared with the deaf community. There really is a large disparity in healthcare services. I just encourage you to listen to our needs with open minds and an open heart, and try to connect with us and make sure that we have equal access to those healthcare services. Thank you. Hello. My name is Joe, and my last name is Adamo. And again, many, many thanks for inviting all of us to be here today. So, love you. That's great. Thinking about specifically ASL Anywhere and the funding that's been provided for that, we are grateful for the funding and the grant that has been provided. But it is a very limited amount of time. I get like 60 minutes for 6 months. So trying to access that when I don't have an interpreter available is very difficult, because the minutes run out very quickly. And then I have to pay out of pocket $61 for 60 minutes. So I hope that maybe we can find more funding to go ahead and support the ASL Anywhere program. Thank you so much. Hello, I just got here. So I had, 1 moment. Hang on. I don't know. I can't. We're asking for clarity. Yeah. I guess. Sorry. He's like, maybe I need to slow down for the interpreters. Loya. Okay. The insurance program, Loya. The 90 days had passed and they had suspended my Loya insurance. And I was hit at a crossing line. So I was trying to file a claim
and couldn't file that claim. And so because of the amount of time that was going by before I could access the insurance, what Nevada State was trying to provide me, they were trying to process it. And after waiting such long amounts of time, I had to do so much work. I had to use the video phone because there was no sign language interpreter. And because through all that, I wasn't able to get the medical care I needed when I had something happen. And I've been here 44 years as a resident of Nevada, and I've had those experiences throughout those years.
Do you mind if I clarify his comment just a tad? No, you're good. You're good. Recently, he was in an accident. and he was supposed to get money from the insurance company. And it's been a struggle through the insurance company not refunding him for incidents related to the accident. So that's been his struggle. So asking for your help with the situation related to insurance. Thank you.
We thank those of you who have taken the time for public comment. And as I said before, we will come back at the end of the meeting and there'll be additional time for public comments. And so with that, we'll close out agenda item number 2 and move to agenda item number 3, approval of the minutes for the meeting on April 30th. Members of the committee, are there any questions regarding the minutes? Assemblyman Gray? No?
No, ma'am.
Okay, thank you. So then I will entertain a motion to approve the minutes of the committee meeting on April the 30th, 2024.
So moved.
Have
So
a
moved.
motion from Senator Dondero Loop. Do I have a second?
Second.
Second from Assemblyman De Silva. Any discussion? All those in favor, aye.
Aye.
All opposed,
Aye.
nay. And the ayes have it. Motion carries. Let's move on to agenda item number 4, presentation on new federal laws and regulations relating to Medicaid services for senior citizens, adult protective services, and discrimination against persons with special needs. So as we have Administrator Stacy Weeks and Administrator Dina Schmidt, and I don't know if they are here down north or down south. Looks like they're presenting Carson City. And while we're waiting on them to come to the table or broadcast to show them at the table, let me just say one of the things that we tried to do as a legislature in 2020 was to make sure that members of the disability community had an opportunity to participate in the voting process. And so part of why we did that was to make sure that you have access to a ballot and you have an opportunity to look at it in the privacy of your home and have a chance to go over it, and you have someone there to interpret for you. And so we may not have everything right, but that was one thing we wanted to make sure that in the voting process, we made sure that the mail-in ballots, that was part of, as I said before, that was part of the reason we wanted to make sure that every registered voter had an opportunity to get a mail-in ballot because of the challenges that some members of our disability community have, and members of the able community, but they are also mobility challenged in terms of either not being able to drive, not have consistent transportation. So when those ballots come out, I do hope that you will exercise your right to vote. That's all I'll say. Okay, so are we ready in Carson City?
Yes, we are.
Okay. Thank you.
Good morning.
Proceed.
Okay. Good morning. Dina Schmidt. For the record, I serve as the Administrator with Aging and Disability Services, and I'm here with Stacy Weeks, the Administrator for the Division of Healthcare, Finance, and Policy. On our agenda today, we're going to cover some new changes in the Older Americans Act and what that impact looks like to our agencies, as well as an overview of the new Access Final Rule and specifically Section 504. And then we want to talk a little bit about some of the impact on services, the future outlooks, and our next steps as agencies to ensure implementation. So starting with the Older Americans Act, as you know, this is a federal law that authorizes grants to states for the provision of programs and services. Through Aging and Disability, we fund services such as supportive services, including in-home services, legal assistance services, congregate meals, home-delivered meals, as well as evidence-based disease prevention and health promotion services, caregiver supports, senior employment services, the Long-Term Care Ombudsman Program, and the Adult Protective Service Programs are all the programs that we provide under the Older Americans Act. In February, ACL released the Older Americans Act Final Rule. This was the first update in many years, so there's quite a bit of modernization. In this rule, we have until October 1st, 2025 to comply. Many of the changes are really focused on access to services and ensuring that we are reaching populations that have the greatest social need. It also requires us a lot of changes to our policies and provisions of policy and procedures, There's a big focus on person-centered planning, assessment, and client eligibility, more transparent definitions under the Older Americans Act, a grievance process, and coordination, requiring more coordination with our Native communities. So the impact to us is really the detailed coordination amongst tribes and local programs. We need a lot more work there that we'll be required to do. One of the other areas is that it clarifies provisions prioritizing people with the greatest social need, and that really does change some of the way we subgrant our awards and some of our reporting requirements. It also clarifies the role of the aging network in defending against the imposition of guardianship. This is a little different than we've had in the past, and it's really making sure that we at ADSD, as well as all of our grantees across the network, are doing all that we can to promote alternatives to guardianship. It also clarifies some flexibility, which is wonderful. Since the COVID-19 pandemic, we all know that our nutrition programs specifically had to become much more flexible. And so some of those lessons learned during that period are carried through in this new update, and so we can do a little bit more flexibility in nutrition programs, things like allowing carry-out meals through our congregate settings. So those are positive changes we've seen. One of the other areas that will impact us as an agency is new requirements around sub-award monitoring and funding formulas. One thing to keep in mind is that the Older Americans Act appropriations don't always meet our current demands. And so that is something that we continue to work. Most of those programs, we are reliant on the Older Americans Act funding only for those services. But there's not a lot of general fund or other funding sources. So it does limit our ability to make sure we're meeting these requirements. Next steps for us to comply with the Older Americans Act rule is really engagement, understanding changes with our community partners, listening and learning about the impact to those community partners, working with them as we create new policies for subawards to ensure that we can be compliant, but also making sure our subrecipients are well aware of the new requirements and also able to meet those requirements. Part of that will require us to train our recipients and community partners on the new rules, and then implementing and monitoring to the new rules. Additionally, on May 7th in 2024, the American Administration for Community Living, as we call ACL, did also release a final rule to establish the first ever federal regulations for our adult protective service programs. The new regulation took effect on June 7th of this year, but we are required to be in full compliance, and we have until May 8th, 2028 to be fully compliant. So with that, I will take any questions regarding the Older Americans Act, or if you'd like to, oh, I'm sorry, I should probably talk about some of the changes to the Adult Protective Service Program. Some of the changes are they set standards for the program, which we've never had before, so all states are required to provide services within those new standards. Tiered assessments to help states differentiate between immediate and non-immediate risk cases. New 24/7 reporting requirements, which will impact right now the way we operate. Core values, making sure that we are again emphasizing person-centeredness and least restrictive alternatives. And then collaboration with our Medicaid partners, our long-term care ombudsman program, our tribal APS programs, as well as law enforcement. The new rule does also require a state plan for our Adult Protective Service Program. We currently have a state plan for Older Americans Act programs, but we don't have one specific to the Adult Protective Services Program, so that will be coming as part of the new requirements. So with that, I will turn the presentation over to Stacy Weeks if there's no questions regarding the Older Americans Act.
Good morning, Stacy Weeks. Oh, go
any
ahead.
Questions? Yep. Oh, yes, I'm going to see if any questions, committee members? No? Okay, Vice Chair?
Thank you, Chair. I do have one question relative to guardianship, and I'm curious to know, with the Older Americans regulations and adult protective services, is there any
language in there that really helps us to identify desires about adult guardianship when necessary? Are there any new guidelines that we need to be aware of?
Dina Schmidt for the record. If I think I'm understanding, it's really, there's nothing specific as far as guidelines as much as it is just ensuring that we are pursuing all alternatives available and really trying to be diligent in making sure that guardianship is the absolute last resort.
Thank you. Additional questions? Yeah, I just have one, and this may or may or may not be right on the edge of the Older Americans with Disabilities Act. But when someone is going into the doctor and they have been diagnosed with Alzheimer's or dementia, and they need someone there in the room with them, is that something that can happen, or is that something that doctors have the opportunity or have the leverage to say, no, you can't come in during the examination?
Dina Schmidt for the record, that is outside of the Older Americans Act policies and regulations. So I wouldn't have an answer at this time.
Okay, can you do me a favor? I'm trying to track that down.
Yes.
Because it just seems a little obtuse. If someone who is advanced Alzheimer's or dementia and they're being examined by a medical profession, and many times at that point of their cognitive ability, shall we say, they may or may not understand what the questions are, or may not understand what the implications of their answers or the questions are. So can you just find out who that responsibility falls under, and I'd appreciate it.
Yep, Dina Schmidt for the record, absolutely. Sometimes it's the power of attorney, sometimes it's a guardian, but I will get the actual law and see what's allowable and follow up with you.
Thank you, because I had someone to say to me that the doctor forbade them from going into the examining room with a patient who clearly was in the throes of the last stages of dementia. Okay, thank you. There are no additional questions. All right, let's proceed.
Good morning, Madam Chair. Stacey Weeks for the record, Division of Healthcare Financing and Policy. I'm here to present the Medicaid Access Rule in Section 504 of the Rehabilitation Act. So I don't know if you guys can see my slides again. I'm going to pull some more up for you. But just some background on the Medicaid Access Rule. So Medicaid is founded, as you guys know, in Title 19 of the Social Security Act. And in that act is a portion of the law that basically requires that states assure payments are consistent with efficiency, economy, and quality of care, and are sufficient to enlist enough providers. And that's when we often hear people refer to the access rule. That's the foundation of that conversation. The challenge is how do states do that, and how does the federal government enforce this? A couple years ago, the federal government, CMS, came out, excuse me, I have a frog in my throat this morning. Federal government came out with a rule called the Access Rule several years ago, and what we just recently saw was an update to that rule. This rule came out and feels like not very long ago, a couple months ago, but it is several hundred pages long and includes as well as a managed care component of the rule. So there are two big rules that came out impacting Medicaid. The Medicaid Access Rule really is looking at both fee-for-service and managed care programs and recipients for Medicaid-funded home and community services or community-based waiver programs. This rule seeks to increase transparency and accountability and standardize data and monitoring and promote active beneficiary engagement in Medicaid programs with the goal of improving access to care. There are three big components of the rule, which are in that pie chart here on the right. There's consumer participation requirements. There are new home and community-based service requirements for the waiver programs around access, as well as provider rates, which also impacts the home and community-based service waiver programs and fee-for-service. So under the access rule, we have, well, today, just so folks may not know, Medicaid does have an advisory committee, which is made up of a variety of consumers as well as providers. It is required that every state have what we consider an advisory committee to Medicaid. This rule updated this requirement to include more specifics around the types of people that sit on these committees, how often they meet, as well as the reporting that comes out of these committees. And so what we're going to be doing is looking up at updating state law to ensure that Nevada is compliant with what we're calling the Medicaid Advisory Committee, or the MAC. The new rule added something new called the BAC, which is the Beneficiary Advisory Council, that sits under the Medicaid Advisory Committee, sort of like an advisory council to the larger committee. And this will include people, actual members of Medicaid, and individuals who are impacted by the decisions. We will be reimbursing under federal law. We have to require that we reimburse for participation of beneficiaries in this council. We also have to make sure that there are term limits, so that individuals aren't sitting on this committee forever, but that we have diverse views, and that people are renewing and turning over and ensuring that we're hearing all voices. We are looking at absorbing some of the work of some of our advisory groups into this larger group, and hoping to have that up and going by July of next year. The scope of the MAC and BAC, there's some changes that were made. They're listed here that are in the rule. It's pretty lengthy. Deputy Administrator Melinda Southard on my team will be leading this effort with our community advisory stakeholder group. And we will be working on that over the coming months to really revamp our advisory committee. The other portion of the rule that has a huge impact that I know members here today are very much interested in applies to what we consider our 1915C and 1915I waiver programs. We have several of these programs in Medicaid that we have authority for at the department. The HCBS waivers include the elderly waiver, physical disability waiver, intellectual developmental disabilities waiver, which, as you all know, is administered by or operated by Aging Disability Services Division, as well as we have a specialized foster care program and adult daycare healthcare program that also sits under these waivers. So all of these programs will need to comply with many portions of this rule. So we have a pretty large team right now looking at the different impacts onto our agency. We're looking at different oversight for HCBS waivers because of this new rule. It really does strengthen oversight of person-centered planning to ensure that it's occurring with individuals from providers who operate and administer the programs for HCBS waivers. It requires states to follow nationwide incident management standards when dealing with incidents that happen for members in the program. Requires standards for monitoring these programs. Requires new grievance system for beneficiaries, which we'll talk about here in a second. Also adds new CMS reporting requirements for the division. We are working on this in coordination with our sister division, Aging Disabilities and Services. So on my team, Deputy Administrator Melinda Southard is leading this effort, and her team, as well as from the Aging Division, Agency Manager Jennifer Frischman. So just wanted to kind of do a quick kind of go from a high level, just thinking about when rules like this come down, how does it impact the department? And so when we think about Medicaid really is kind of sprinkled throughout the department in many ways, right? So DHHS under federal law and state law is considered our single state agency for Medicaid. It's responsible for administering and supervising the administration of the Medicaid program. CMS ultimately, at the end of the day, would hold Medicaid as DHHS accountable. The director has delegated the administration of the program to my position as the administrator of DHCFP, which is the state Medicaid director role. And DHCFP administers the Medicaid program, but also is responsible for administering all the waivers as well, and ensuring that we maintain the appropriate authorities under federal law to operate those programs, that we are monitoring funding that goes from the federal government to our sister divisions to operate the programs. And obviously, anytime one of these rules come out, we have to work in coordination with our sister divisions that are impacted. ADSD is under our waiver authority from the federal government, is the entity that operates the programs, the waivers that we have. And these parameters are set with DHCFP, and they're approved by CMS. And again, these are our home and community-based waivers. So one of the big new things that are coming out of this rule that many states are looking at right now is how do we implement an independent grievance system for HCBS beneficiaries? And because it has to be independent from the individuals who made the decision about a benefit or a service, this program will be built under DHCFP, my agency, in the coming years or year. This new system will allow individuals or representatives to file grievances orally or in writing at any time regarding a decision, acknowledges the receipt of the grievance, and provides notice of resolution. We're supposed to ensure fairness and independent review of all information. It will provide a reasonable opportunity for the beneficiary or the representative to appear in person, via phone or video, and to present evidence or testimony and make legal and factual arguments about why they are owed the benefit. It provides the beneficiary their case file, including all medical records, and provides language services, including written translation and interpreter services. We have to ensure that there's no punitive or retaliatory actions taken against the filer of the grievance, and we'll be maintaining all records of the grievances filed. The second thing that we need to build out in Nevada is an incident management command system. And we will be doing this in coordination with our sister division for aging and services and disability services. But by July 2027, we have to have this incident management system up and going. And we must operate and maintain an incident management system that includes identifies, investigates, resolves, and tracks and trends all critical incidents that we receive, including reports of abuse, neglect, and financial exploitation. We'll have continuous quality improvement process has to be included as part of this system, including monitoring, remediation, and quality improvement programs. States are required to show that they meet this requirement at the minimum performance levels. And there's a lot of transparency around this with the federal government too. But some of this information obviously is confidential given the content. Like I mentioned earlier, there are a lot of more reporting requirements to CMS under this new rule. It requires state Medicaid agencies to report to CMS on waiting list for all of the 1915C waiver programs, and also service delivery timelines, how long basically it takes for an individual to get a service for personal care, homemaker, home health aid, and habilitation services. And it requires us to use a standardized set of HCBS quality measures in measuring the quality of the program. It requires new public transparency around these issues related to the administration of the program through public reporting of quality, performance, and compliance measures. While we'll be sending these to CMS, we'll also be reporting many of these on our website as required under the rule. DHCFP will collect data from ADSD for reporting purposes and will post it publicly as needed for compliance. We'll also be bringing on vendor and consultant support to support the implementation and improve oversight and compliance of our HCBS waiver programs in Medicaid. All right, the other big piece is waiting list. So going forward, states must report to CMS annually a description of their waiting list maintenance and process, including whether the state screens individuals for eligibility for the program, whether the state periodically rescreens individuals on the wait list, frequency of rescreening, the number of people on our waiting list, average amount of time individuals newly enrolled in the waiver were on the waiting list, and average time waiting for services once approved for the waiver. As I mentioned earlier, we do need to look at a consistent standardized quality measure set. It's my understanding we already do many of these. We look at these quality metrics today at ADSD. Part of the new rule will be requiring that we be reporting this information to CMS, but really looking at these issues. The priority areas are person-centered planning, health and welfare, access, beneficiary protections, and quality improvement. CMS has not finalized the entire measure set at this time, but we'll do so through a process that allows for public input and comment. So we'll know more about some of this in the future, hopefully not too long from now, so we can plan. Sorry, still going. Access rule and payment adequacy for HCBS. This is actually a really a big piece that a lot of people, you've probably heard in the news and people talk about earlier in the public comment. I just want to start out by saying this part of the rule, while it's really important and impactful in many ways, it's not effective until July 2030. That's 6 years. So I just want to be cognizant of that today. Obviously, states have the discretion to move forward before then, but from our perspective, Unless state law changes and funding is provided, we will be following current law, and we'll be proposing changes, obviously, to comply by July of 2030. HCBS rates to certain providers must be adequate under the new rule, adequate enough to ensure a sufficient direct care workforce. And the new rule defines the direct care workforce as direct support professionals, personal care attendants, home health aides, among registered nurses, licensed practical nurses, nurse practitioners, clinical nurse specialists, licensed or certified nursing assistants under supervision who provide nursing services to HCBS beneficiaries. So under the rule, at least 80% of the total Medicaid reimbursement paid to the provider agency must be spent on compensation to the direct care worker, who is providing the services commonly referred to as a wage pass-through. Last session, we had something similar here pass. It was called a minimum wage requirement. Some of you may recall that requirement. We have since implemented that, and we are assessing that now to see if it complies with the 80-20 rule. I apologize, I do not have that analysis here today, but we are working on that. There are exceptions in the rule. I know some folks, there was some public comment around this about being too small to take on some of these requirements. There is an exception under federal law for small HCBS agencies where we can adjust the requirement down from the 80%, so to adjust for the size of the agency. So I just wanted to note there are some ways here to acknowledge the size of an agency and whether or not they can take on that type of 80-20 requirement. There's also an exception just to even comply with the rule for extraordinary circumstances. This exemption applies to reasonable number of providers facing extraordinary circumstances that prevent compliance. Some of this may be like a public health emergency, could be something to do with the geographic region. We're still trying to understand these pieces of the rule, but I just wanted to note there are exceptions and things that we are working on now with CMS to better understand the implementation. So on my end at the agency, Deputy Administrator Melinda Souther will be leading the policy side of this with her team, as well as Deputy Administrator Jennifer Krupp. She'll be leading the fiscal and rate side, and we'll be looking at our current law to see if we are in compliance. I apologize. That time frame is, the print is very tiny, so I'm going to do my best to read that to you so you are not squinting. I'm squinting. So the time frames here, as you can see, this is multi-years. We are looking at 6 to 7 years of implementation work. It's a lot of work for Medicaid agencies and their sister divisions and other agencies nationwide. So this is a pretty big effort. The first piece is really, like I mentioned earlier, working on our Medicaid Advisory Committee and our Beneficiary Advisory Council and getting them stood up by July of 2025. We are hopeful we're going to have a lot of this going before then and be working toward making sure we can fund reimbursement for travel and everything for beneficiaries to participate. So that is the big piece that we're working on. And then by July 9th of 2026, we'll be working to get our grievance system up, publishing fee-for-service payment rates, and the comparison to Medicare. That's another piece of this rule. So states have a better sense of where they stand on their rates. There is a report out there on Kaiser Family Foundation if folks are interested on this today and how we do across our providers. There's also, we have to do our first, what we call our MAC report for our advisory committee, which will be available by July of 2026. And then in 2027 of July, we're looking at having our incident management system stood up, person-centered planning, compliance reporting, wait list reporting, and all the website transparency pieces up and going. And then by 2028, we'll be working on payment adequacy reporting for personal care services. So that's when we start to look at how are we doing in terms of compliance with our 80-20 rule. That will be, when we start looking at that, we have to start reporting it to CMS so they know where we stand. Then we have to start making sure we're using the most up-to-date CMS quality measure set for reporting and monitoring the quality of our HCBS waiver program. And then by July 9th of 2029, we'll have an electronic incident management system up and going. And then by July 9th of 2030, we must comply and ensure that our rates comply with the payment adequacy standard, which is that 80-20 rule for facilities that provide these services. And that's a lot of information. I don't know, Madam Chair, if you want me to stop there or keep going. If you guys have questions on that, I'm happy to keep going, and then we can open it up. It's however you want to. I'm almost done, I promise.
Let's keep going.
Okay.
Let's
Got it. All right, Section 504, final rule. This is the rule that regulation has just been updated. The regulation comes from the Rehabilitation Act of 1973 in Section 504, which really prohibits discrimination based on disability and programs and activities that receive federal financial assistance. So essentially our Medicaid program, any of our programs that benefit from federal funding. The final rule really does clarify several areas not explicitly addressed in the current rule, especially around some of the major judicial and legislative developments from the Olmstead ruling as well as the ADA. Some of the big changes from our perspective, there's a lot in the rule. I don't want to overlook that, but there are three big things I think I wanted to mention here today for this committee. There's a lot more in the rule, but the big one is the medical treatment. It really is outlining and clarifying and how we prohibit discrimination and treatment decisions for people with disabilities. We, right now follow that as part of our Medicaid provider enrollment process, but we'll be making sure that that's very clear in our provider, basically it's like a contract that they sign with the Medicaid program to hold them accountable. Web and mobile requirements, there's a lot here for agencies to be working on and defining accessibility for websites and mobile applications. This is going to be a big piece at DHHS, and I think it impacts all of us at DHHS in some way. Olmstead, really it codifies in regulation the Olmstead decision. So it's no longer just a court order that impacts how we read the regulations. It really codifies that as regulation and requires states to ensure community-based options are available for individuals with disabilities. So I think that's the last slide, and I will turn this off and we stand for questions.
Committee questions? Vice Chair.
Thank you, Chair. Thank you so much for the presentation. There's a lot to unpack here, so I'm not going to attempt to do that now or here, but I do have one question. We heard earlier today about personal care attendants being in a section of NRS that is medically focused, and then I see that the HCBS is focusing on a direct care workforce, and you talked about direct support professionals, personal care attendants, home health aides. They all seem to be in a different section of Nevada revised statutes. I'm curious to know, have you considered how the access rule is going to change, how those positions are regulated or overseen, or what are the implications that you can see that are coming relative to all of those direct care positions at this point?
Madam Chair, Stacey Weeks for the record. From our perspective, the big piece is going to be making sure the reimbursement side, which is typically done through the budget bill. So making sure that we're compliant on that end. Some of the other requirements we can put in through our enrollment process, as well as working with our sister divisions on the provider licensure and certification. But I don't necessarily think it requires a rewriting of all the chapters of state law. I think you can still ensure that all the pieces comply. We just have to make sure on our end that they do. The nice thing about this rule, I say it's nice and probably isn't always nice, but we have to report all of this as CMS. So it's not like something can be missing and we won't know. Like CMS will be making sure that everything is compliant. So as we go along in that process, we'll be able to better understand if there is something in statute that needs to be changed.
May I please add something?
Yes.
Okay, Dina Schmidt for the record. So I just also wanted to say one thing to keep in mind is the real focus on person-centered planning and person-centered efforts is one area that does differentiate for personal care services. Currently, they are, as you heard earlier, are regulated the same as a facility. And so trying to balance person-centeredness with regulatory sometimes is a challenge, I'll just say. And so that is a difference here in the way that we've approached this historically. Thank you.
Thank you. And I don't know if you just answered this or not, but so I'm thinking about, they may be in different sections of the NRS, but is there anything we can do in terms of some type of overlap in the NAC? Because sometimes if people are looking in one place and they don't see it, sometimes people won't go to the next or try to figure out where it might or might not be. So in the administrative code, is there a way to address that?
Madam Chair, Stacey Weeks for the record. I think it depends on which portion of the rule we're talking about. So for the advisory committee and all the consumer activities, that will be statutory. And there is no code for that because Medicaid is exempt. Some of the pieces for the provider rates, that will be funding. So what we need there is money, and to make sure that we are compliant on that piece in the budget. The other piece where it talks a little bit about HCBS requirements around licensure, enrollment, and some of those pieces, I think you could do through the Nevada Administrative Code, or we can do through our Medicaid Services Manual policy. I think, again, as we kind of move forward with CMS on how these pieces will be implemented, we'll have a better sense. But overall, I think we don't see any major changes to statute at this time.
Thank you. Thank you. Ms. Weeks, if you don't mind, I'm just one follow-up question. Can we look to your budget to be able to fund those adequate rates, or are you going to require separate legislative action in order to make sure that we have funding appropriate? Now, granted, you also talked about the timeliness of this, right? Not until a number of years down the road. So I'm curious to know, are we leaning on you or are you leaning on us?
Madam Chair, Stacey Weeks for the record. I love that question. I think we're leaning together. Honestly, I don't see us, I mean, I can't speak on behalf of the budget. I want to be mindful of that. But given that this is not in effect until 2030, we are not coming forward at this time with a proposal to do the 80-20. So if folks want to move forward before we are required to do that, then a legislation would be required. Hopefully that answers your question.
Thank you. I just have a couple questions. I want to go back to slide number 10. Scope of the MAC in the MAC. And my question would be on diversity. How are we comporting with the opportunity to make sure that there's a lot of representation, diverse representation on those boards? And I'm thinking not just with respect to ethnic, but I'm speaking in reference to linguistic, LGBTQIA. What are we looking at in terms of veterans? Because if we're going to serve these communities, then we have to have representation across the board, especially, and this is one of the reasons I brought the bill in 2017, about cultural competency, to make sure that we have people that are on these boards, or on these committees and commissions, that understand the nuances in particular cultures. So can you talk to me a little bit about that?
Yes, Madam Chair, Stacey Weeks for the record. Those are all very good questions. So the new rule does outline explicitly a lot of different types of members. So I think we'd have to comply with that first. If members want to add to that, they would need to put to it in statute. But I do know we're going to be doing a broad outreach to stakeholders, a variety of stakeholders, and through our listserv, but also in different community settings. We have to do more of a application process, so people have to apply to be on the committee, and we'll be working on those that information over the coming months to get out before January.
And I guess one of the things that I would like to see is casting a broad net, and some of the ways that we usually advertise for these positions. There may be people in other communities that don't necessarily ascribe to those ways. And so I would advocate for casting a broad net, radio, PSAs, perhaps in some of the faith-based communities and that sort of thing, because sometimes what we find out is that once the commission or the committee is already put together, then the standard answer is we couldn't find anyone. But then I go back to some of the communities that are not represented, and they say, well, we didn't know. So I'm advocating for casting a wide net when we start looking at advertising and outreach and that sort of thing. Does that make sense?
Madam Chair, Stacey Weeks for the record. Yes, it does, and we will definitely take that back and do that. So thank you.
Okay, just a couple more questions on slide number 13. And you may have already answered this. We heard several comments during public comment about how some of these grievances or whether or not people can refuse and what the standards are. And I'm very concerned about that, especially if we don't have anything, if it's not in our NRS and it's not in NAC, what do we do to make sure that people are just not arbitrary in their refusal to provide services.
Dina Schmidt for the record. So this grievance system, many of our programs currently have grievance system processes. The new Older Americans Act outlines rules regarding grievance for those programs, and then the HCBS rule outlines the new grievance system. It is much more detailed than previous systems we've had. And currently, there is a grievance process as well as an ADA, as you heard, ADA complaint process that we follow in our organizations. So I would say that this new rule will enhance and modify some of the ways we handle our processes. And it really, the nice part about this rule is it pulls it out of our agencies and makes it an independent third party. Currently, the rule requires us to do that process, which sometimes seems like a conflict of interest for both us and the recipients. So this will be a benefit because it will pull it out to an independent group that will make the determinations for us.
And perhaps what we need to do is make sure that providers understand this and are aware that the refusal cannot be arbitrary. And then if that standard is not met, then what are the consequences? And you don't have to explain that to me, but explain that to providers, what the consequences are, so that it's not an arbitrary thing. And especially when we start talking about reporting, once that is reported, then what are the steps that are taken to make sure that that provider, if they don't understand what the process and procedures are for being a part of this program, then what are the processes that we can go through to help enhance their understanding, shall I say?
Dina Schmidt for the record, yes. And in fact, the new 504 section also has new requirements around exactly that, that the state agencies have an obligation to ensure providers are not being discriminatory in any acts. So that will also be enhanced as we move forward.
Last question. In 2017, we addressed the interpreter situation. One of the things that we tried to do during that session was to look at interpreters who would be on site at hospitals, especially in emergency rooms. And I think we heard a couple of comments that that is not the case. What can we do to make sure that that is available to deaf persons and make sure that it is available in a timely manner? Because in some instances, a health crisis the difference of seconds or minutes can be a matter of life or death. So is there anything that we can do as a state? And I know that ultimately it's probably up to the hospital, but I want to know, what can we do to make sure that people that go to not just emergency rooms, but we also have the neighborhood hospitals, if you will, now. And so how can we make sure that there's coverage there for persons who are deaf?
And Dina Schmidt for the record. So I can't speak on behalf of hospital regulations, but I do know that under the Americans with Disabilities Act, the hospitals have a requirement to make appropriate accommodations. So I would defer to the Division of Public and Behavioral Health as far as what they could do to hold those hospitals to that requirement.
Okay, thank you. And I want to ask if the DBPA is not here, then let's get somebody, because I'd like to see if we can answer that before our committee meeting is over. And appropriate, I guess, is a matter of interpretation. So we want to make sure that appropriate means and timely means that it's not 3 hours or 4 hours, but it's within the hour that happens. So if we can get somebody there, and also somebody from the Hospital Association, if you are listening in, let's see if we can answer that question and get that answered online. If we can't get it done before the meeting's over, then I'll make sure the committee members have it, and we'll try to make sure that it's posted online for those who have had that question and need an answer to that, okay? Committee, additional questions? All righty, then let's move to agenda. Thank you so much. Let's move to agenda item number 5. Presentation of the annual report required by Assembly Bill 100 related to an evidence-based family caregiver assessment.
My apologies, I just need to fix the chair.
That's okay.
New room, new chairs, not much fixed. Hopefully you can see me. Cheyenne Pasquale, Planning Chief with the Aging and Disability Services Division for the record. Thank you for having me here today. AB 100 was passed in the last session and required us to pilot program implementation of a caregiver assessment. We are behind on our goals, mainly due to staff turnover. We are working with finalizing a contract with the UNR Nevada Center for Excellence in Disabilities to expand our work under our federal lifespan respite program. And this will include facilitation of a work group to help us identify and implement an assessment. As I was preparing for this presentation, I had the opportunity to reflect on past efforts that we've had around a caregiver assessment and data specifically related to family caregivers. In the past, we have implemented the BRI care consultation, which is a resource and support services for family caregivers. That service is being maintained in the community by providers. We have piloted a caregiver intake through Nevada Care Connection, our resource centers. The downfall with that is a mechanism to collect the data. We've explored using existing off-the-shelf products such as TCare, Trulta, or Archangels. These are the most comprehensive off-the-shelf options that not only lend to caregiver data and assessment, but caregiver support and services ongoing. They come with an ongoing financial commitment. We have gathered existing assessments from current respite programs as well as other states, and we compared that data that is collected with data required in this bill. Our goal with this pilot is not simply to do another pilot. Our goal with this bill is to do a pilot that has broad support and buy-in across multiple programs. To do that, our contract with the Nevada Center for Excellence in Disabilities will be vital in helping us to develop a work group that can provide input and buy-in early in the process and expand utilization beyond the pilot. Currently, we are on track to have our contract in place and would expect to be able to pilot an assessment by January of 2025. And that's my update.
Questions, any members? Yes, Vice Chair.
Thank you, Chair. Thank you so much for this presentation. I know how hard it can be to come and say, we didn't do it yet. And so I appreciate that you're here and you do have this wonderful, robust report, knowing that what we're really trying to do is for the future, right? So that we can identify where people are and work to deliver their supports to keep them in their homes safely served. And so I just want to thank you for the efforts that I know that your division has really been working on over the course of this last interim in particular, and that you've had a number of challenges. I also appreciate that it's not fallen off of a priority list. And so for me, that's personally really important as well, since I carried the bill. And so I'm grateful that we continue to work on identifying where our caregivers are so that we can help them be successful in their homes. So thank you.
Thank you. And I just have a comment. I think it was the 2019 session that we had a bill that was brought by one of the senators that would provide a framework for family members who were caregivers as well. I don't know if there's been any reference as you all look at how the pilot program can be structured or what might happen as a result of the pilot program. And just as soon as my privileging kicks in, then I'll be able to tell you what the bill was. But I know we did that, and we had a couple of family members who were already caring, especially in the rural areas where it's very difficult to get caregivers who are not family members. So, but that bill was in place, and that might be something that you can lean on as you look at implementing the pilot program.
Cheyenne Pasquale for the record. Thank you for that suggestion.
Additional questions, comments, committee members? Okay, thank you so much. Okay. So let's move now to agenda item number 6, presentation on the impact of regulations to the personal care industry and overview of Medicaid regulations concerning payments to certain direct care workers. Robert Crocker, and I think you were here, so let's begin when you are ready, sir. Yes, please. It's full screen for you. Oh, yes. Data.
Thank you. I don't know if the slides are up or we can see them. Thank you for Senator Spearman for inviting us to give this presentation from the Personal Care Association of Nevada. I'm Bob Crockett from Advanced Personal Care Solutions. This is going to be our solution to the Medicaid access rule. We can go to the next slide. So I think Stacy Weeks had mentioned some of the stuff that's out in the general public. Here's 2 quotes about what they're forecasting is going to happen. You can read that off. 93% of us will limit new referrals. We're going to exit the rural areas. We're going to cause cuts in things and different things. The Home Care Association of America said that Medicaid agencies will actually exit the Medicaid program, and 64% of providers are going to reduce their service levels. The key number here is the average agency spends today 20 to 32% of their reimbursement dollar on administrative costs. So if the 80-20 rule is to get you to 80% and an agency is spending 30% on admin costs, they're at minus 12% with no profits. And what we're going to try to propose here is a way to reimagine personal care so we can actually cut that. Well, I want caregivers to get 80%. I want that 20 to 32% to go to 16 and 10 to give us all a fighting shot. We have to operate completely differently, and we're going to go over this. I actually think it's kind of exciting. So these proposals elevate everybody. We can go to the next one. They're saying that we're going to leave the rural areas. We want to go into the rural areas. Challenging and difficult cases aren't going to be served. We want to fill those. We want to actually get into socially isolated elderly people and make sure that we can see them and keep them out of the hospital. We want to create career paths for personal care attendants, elevate their knowledge with specific trainings, could be ASL, as I've talked to some of these wonderful people here. What an opportunity to fill a service gap. I've never thought, should I have caregivers who could sign? It never occurred to me. Well, I look out here and I see potential caregivers and an opportunity to fill a gap in service. I believe we can reduce healthcare systems costs. I believe personal care is a profit center. We should never be taught if we look at personal care through the correct lens, we reduce hospitalizations and keep people out of institutions far and away higher than what you're spending on PCA right now. If we're focused in the proper areas, we're going to save a lot of money and everyone gets elevated. But we need to improve and streamline our operations. We need transparent communication between caregivers, clients, and agents, different state agencies. We need to develop clear and defined expectations. A lot of times agencies aren't quite sure what we're doing, and we need to move away from aggressive accountability into supportive accountability. We can go to the next slide. These are the 5 proposals. Personal care attendants should be W-2 employees. They need the dignity, the benefits of being an employee. The SB 340, which I served on that, there's a resolution out of SB 340 that if you're a Medicaid agency, you cannot hire independent contractors. We'll go over this in a little bit more detail. And when we talk about moving us out of NRS 449, there's a very specific reason. We are whipsawed. There's all sorts of healthcare legislation that goes through every legislative cycle. We're in the field where including these categories. That includes us. We need to be flexible. We need to go to the remote rural areas. We need to be able to change our stuff. If we say maybe clients or caregivers could be 16 years old, much easier if we're isolated in our chapter. If we want to teach life skills or personal care skills in a rural school, which we'd use the background to recruit caregivers, we need the flexibility to be able to train them for that. We need our own cap. We've talked about this for a decade. We need remote caregiver, care recipient, caregiver management system. From personal experience, we can monitor people remotely and keep them out of the hospital. We can hire and train remotely. Tiered series of reimbursement. We got to get it with lockstep with everybody else. The 80-year-old woman who's very nice and friendly, who needs 6 hours of service, very different from the Hoyer Lift combative client that we have. But right now it's all paid the same amount. Doesn't matter if you're going to the grocery store, you got to move somebody at 11 o'clock at night on a Hoyer from their bed to the bathroom. The pay is the same, and I can't find caregivers. We all run to the bottom. Family caregivers, boom. We got huge gaps in service. This fixes that. And then the most important thing is the portal. It's really exciting. And we'll get to it, but this is the information hub for personal care that we onboard caregivers into the portal, where we see Medicaid announcements and a caregiver can put themselves out there because they need more hours and an agency can pick them up, or a client can do the same thing. So we can do a ton of good in this state. We all need to be on the same page and have the same agenda. I'm not going to spend too much time on W-2 employees, but it's fair. And when we talk about vulnerable, at-risk employees, those are my caregivers. They should never be classified as independent contractors and be forced to pay their employer's portion of Social Security. We need to protect them. Let's go to the next one. I want to get to the quote here from Julie Sue, the acting Secretary of Labor. Misclassifying employees as independent contractors is a serious issue that deprives workers of basic rights and protections. I don't know anything legislatively that needs to be done. I think it could all be in motion because we did approve it at SB 340. We discussed caregiver protections at SB 340, and we did approve that. We ban independent contractors. I'd like to see the Medicaid meetings, however you guys do it. We get that going. Next one. The removal of NRS, us out of the NRS into our own. I don't know exactly how you phrase that, but we've been talking about this for a long time. To survive the Medicaid access rule, we need to be nimble And we need to have right fit training, not just training that somebody else thought we need to have, but we can do a much better if we're focused, but we need to be able to move quickly. And there's an appendix that shows the infection control legislation, 13 questions. I missed 11 of them. They want my caregivers to go 4 hours, and that's supposed to be free training. It's hospital training. I had to look stuff up on the internet to see what it meant. And it focused around hospital infections. Well, they're not my infections. Train us how to take care of your mom and dad in their homes, and not what we needed to do legitimately, training for a hospital. It's the opportunity cost. Maybe it's 4 hours for hospital infection control. Maybe it's ASL language. It's opportunity cost and the focus. And we'll go to the next one. What we can do, specialized training. We can have certified dementia-trained personal care attendants. Let's do that. 13,000 caregivers in this state, 100,000 of annual training. Let's claim those 100,000 hours and let's tell agencies, the state puts it together. How do we reduce readmissions when they come out of the hospital? What's the first thing we should do as a PCA? Maybe we have an advanced directives program, a pre-diabetes program, a CHF program, a fall risk management program. We can do all that. We do none of it because of where we're lumped. And I think the state should be directing public health policy, the most impactful things that can be done, a couple hours a year. What might it be? What to do when you get released from a hospital? PCA-centric cultural competency. I'm a fan of cultural competency. I think every single administrator in this state should go to 8 hours a year of cultural competency. Probably not going to make me a fan of some people, but we set the culture. My caregivers may have been 30 or 40 years. If you're an adult taking care of an adult disabled children, they might not have needed 8 hours. Maybe they needed something about taking care of their child and reducing stress in their home, which is what the SB 340 board asked for. So that's all we're asking, something for PCAs in the home. Again, nutrition, healthy meal planning, advanced directives, PCA-centric training. We can go to the next one. Other reasons, waivers, and these would be, we have these conversations. Other states, family caregivers, they waive nonviolent background check. I mean, if you got a nonviolent conviction, we waive that. We should do that. We should redeem these people. The way we handle TB, there's a lot of states that don't do TB. They do a baseline. How we do background checks. I've had my fingerprints done 5 times. They haven't changed. Why do we have to keep doing it? Just press a button and rerun my background checks. We want to go to the rural areas. We need the flexibility to make those changes. We do them in our thing. And what's unpopular, I'm sure, for agencies, we need minimum capitalization requirements for agencies so they stop missing payroll. It's not that hard for us to do, but we should ask everybody to do it. And then we need to create certified personal care agencies. Maybe that's where we have ASL sign language, people who can do ASL, and that the reimbursement's higher. And again, transparent communication, we're in dire need of it. We can go to the next one. Remote caregiver, care recipient, caregiver management. We went through the pandemic. I know we can operate and manage employees throughout the whole state from a centralized office. So there's no reason not to get somebody out there, but we all have to, this is a collaborative thing. I believe we can find caregivers. How do we reach them? I can't hire a caregiver in Minden or Tonopah, it's too far away. I can if we have a remote caregiver management system. I can train them, Zoom, we can have video calls. We can have, you can provide, maybe it's not the best service, but we're all remote now because we have the EVV system. Everything is electronic, and we can upgrade our EVV system and target those people. And then with the young people that we hire in the rural areas, those are awesome jobs. And if we get a high school kid or someone a little older, why don't we do tuition reimbursement for entrance into healthcare careers. There's so much that we can do when we collaborate. Again, moving us to our own 449 location gives us the flexibility to make the changes to address the issues. Tiered reimbursement, many states do it. I talked about it again, so I talked about it already, so I won't talk about it too much, but difficult, challenging cases that don't have family caregivers are the cases that are not being filled. We can fill those with tiered reimbursement. And those cases that aren't being filled that are complex are also the people that are going to the hospital. We need to get out there and take care of them. The tiered reimbursement, we don't look at $20 minimum wage, $30 reimbursement. We look at a $20 average, $30 average. Sometimes cases are worth $40. I might pay my caregiver $30. I don't want to say they're only worth $20. They've got incredible skills. We just need to put them in the right light. Next one. The $20, so I think Stacey Weeks said the Medicaid access rule doesn't start till 2030. 2030, $20 minimum wage, $30 flat reimbursement rate. That's the Medicaid access rule on steroids. You're talking about doing it next year, right? I can go with my calculator to any one of you and tell you that 2030 is over 80%. 7.65% payroll taxes, 3% workers' comp, 3 or 4% unemployment insurance, PTO, 3.3%. It gets up to 80%. I haven't given a single benefit yet. We need to work on averages. And there is a business model 2030 works for. It's a scalable model. If you're big, it works. If you're small, you're out of business. And you are out of business. Anyone wants to just look at a spreadsheet, we can go over that. $1 million company with 40 or 50 caregivers is bigger than 94% of the businesses in this country by number of employees. And we tell them after they pay for rent and utilities and phones, they have $1 million company that big has less than $100,000 to spend on administration. Where are we hiring great people to run these and take care of your mom and dad? It doesn't work. I'm not saying we need more money. I'm just saying there's a different way to look at it. And what we can do when we're partners and not at the bottom of the totem pole of healthcare, we save money. We are a positive ROI. The more money you put to us correctly and not fire hose it, the more money we're going to save you. Next. So, tiered reimbursement. My caregivers get rewarded for taking hard cases. They acquire additional skills. They learn how to use a Hoyer lift or transfer a heavy person or give a bath. Not everyone wants to give strangers a bath. They get paid more. They don't get paid more right now. If as an agency, if we have initiatives, we get paid more for going in these areas. And the state healthcare system can help us target these people, and we'll just put programs. We just need to figure out what to do. This all leads to the development of businesses that will have business models that address the care gaps. You might have an agency that wants to do rural. You might have an agency that wants to specialize in people that need ASL. You might have an agency that wants to specialize in dementia care. We can't do it now, but we could if we were partners and you asked us. And then we have the career paths. So important to create these career paths. And there's career paths within personal care. So we can start, like you're just doing shopping. Maybe you're doing hands-on and giving someone a bath. Maybe you're using a Hoyer lift. Maybe you're dealing with a combative client. You get paid more for those skills. Next. And then, again, I like the idea of kids, young people, I should say, worked in the PCA program in the rural area. They could get reimbursement or some kind of credit for college. That's the way we build these. The information portal, which is the last one, may be the most important, and it's also the hardest to explain. But people are always upset with agencies. If a client needs to transfer, he's going to get a list, or she or he will get a list of agencies to call. That doesn't work. We have too much technology. You need to be able to go into the portal, and if you're a client, look for an agency, or if ADSD gets 50 more slots, they can put those people out there. We can all bid on them. If a client went out, or if ADSD went out and put cases out there, I can guarantee you my caregivers are going to call me saying, boss, there's a client over by me. I want them. Yes, we're going to address those backlogs. This is a mock-up of SB 340 when we talked about the information portal. If you were just coming in and looking, and we can do this through the agency licensing process, and you ask these questions, they're yes, no questions. The client or caregiver or agency just goes in and says what they want. I want VA. I want them in the waiver program. I want someone that ASL. That could be a question. And then they get a return list, and they can click on their website. They can call them. They can go see their facility reports. And it's time to do this. And this is scratching the surface. You know, we did like version 1, 2, 3, 4. In version 4, when caregivers get like little suitcases of information that has all their requirements, that's immediate portability to another agency. You don't have to wait for a month and try to find an agency. You pick the best agency for you, send your little folder over there. We orientate you, and we're off to the races. There's so much we can do, but we have to be able to visualize it. Next, other things we would add through, and hopefully someone will pick this up, but job boards, help wanted, caregiver training, access to medical manuals, state announcements, entities, any entity in the state could post unfilled cases and post questions. And that's just the beginning. Like I said, it puts the power of information where it belongs with caregivers and clients. I don't need to be the one that knows everything, and neither does ADSD. My clients and caregivers deserve to have access to that information. In conclusion, we want to implement these and build career paths, address service gaps, grow a well-trained professional PCA workforce, remove unnecessary rules and regulations. And the most important thing is I don't want to be here 2 years, 4 years, 6 years from now begging for money. I want the cost study that we approved at SB 340 done, so we show we have a positive ROI. And if you give us an extra, I mean, it's live, if you give us an extra 50 million, we're going to save you 100. We should do that. And you should make us partners in addressing Olmstead issues. We are the people in the community. If you got an Olmstead issue, ask us. Let's see if we can fix it. And the tiered reimbursement gives us the flexibility to pay for that and get them out there and fix it. You don't want to say, well, it's $25, so I'm only going to do someone locally. Can't do them because they're 5 miles away. We'll fix that, or 50 miles away. We'll fix that. Sorry. Anyway, there's reason for excitement. I think we can be partners. I consider us like a moat around the Medicaid healthcare system. You give us the tools and fill up our moat. We're going to keep people out of the hospital. We're going to reduce readmissions. We're going to delay people going into institutions. Every single person wins. Agencies are better. The state's better. The client's better. The caregiver's better. That's the end of my presentation. If anybody has any questions.
Thank you. Committee members, questions? Vice Chair?
Thank you, Chair. First, thank you for the presentation. I appreciate the detail and understanding where I look forward to continuing the conversation relative to personal care attendants. You talk a lot about the Medicaid funding rates, right? An 80-20 rule, and personally, I understand that. But I'm curious to know, do you have private pay patients, private pay folks? Do you bill private insurance? Or is it all specific Medicaid funded?
You're talking about my agency specifically? I pretty much, Medicaid is where I want to be in my life, is taking care of those people. There are people who do private pay, and it might be $35, $40 an hour. The VA rate, we do VA, it's over 40. And that's shopping and meal prep and stuff like that. It's not using a Hoyer or doing anything hands-on.
Thank you. Thanks for that clarification. I look forward to following up.
Yeah.
Committee members, additional questions? Assemblyman Gray, question? Okay, I don't think we have any additional questions here. Comments? Okay. All righty. We've got in front of us some recommendations that have been proposed, and they're in our work session today. However, this appears to be an actionable item, and I'll entertain a motion from the committee to act on the recommendation. Specifically, number one, expand ADSD frail elderly waiver, which provides community-based in-home services to enable the frail and elderly to remain in their homes and avoid placement in a long-term care facility, to permanently include nutrition and attendant care services offered in the home and community-based services waiver for persons with physical disabilities. And number two, create a caregiver portal for caregivers and recipients, which will connect recipients and caregivers to avoid caregiver deserts, confusion when trying to contact service providers, duplication of services, and caregiver poaching. Is there a motion?
Yes, Chair, I'd like to make that motion.
I have a motion by our vice chair. Is there a second?
Second.
I have a second by Senator Dunhill-Luke. Discussion? I just have one thing I think for discussion, because I didn't hear this. There are some housing units for the elderly. Do you all work with them in terms of coordinating care? And I'm thinking specifically about one that just opened up in my district with Nevada Hands.
Depending on the facility, I do have people in facility.
Okay, you know, this is not an assisted living. It's just it's a senior housing unit.
Yes, if it's straight senior housing, I'll go over there.
Okay, all those in favor, you've heard the motion, discussion, all those in favor, aye.
Aye.
All opposed, nay. And the ayes have it, the motion passes. Thank you.
Thank you.
We'll move now to agenda item number 7, presentation by the Interagency Council on. And Doug Williams is presenting from Las Vegas. Welcome, and please begin when you are ready.
Morning, Madam Chair, Vice Chair, members of the committee. For the record, my name is Doug Williams, and I'm a supervisory human resource analyst for the state of Nevada. And I've been the Veterans Coordinator for the Division of Human Resource Management for almost 9 years. I have also had the honor of serving as the chair for the Interagency Council on Veterans Affairs since 2019. Also with me today up in our Carson City location is my supervisor, Brian O'Callahan, who is a Deputy Administrator for our Division of Human Resource Management, and he can also be available to answer questions from the committee today. I truly appreciate the opportunity to provide an overview on the Interagency Council, also known as the ICVA, to this committee, as well as a summary of the reports that the ICVA collects on an annual basis, and a summary of our most recent ICVA biennial report that was provided to the Governor and the Legislative Council Bureau Director earlier this year. As a military veteran myself, I would also like to personally thank Senator Spearman, Assemblyman De Silva, and Assemblyman Gray for your service to our country and thank all the members of this committee for your service to Nevada citizens and our veteran community at large. So first, I would like to provide a brief overview of the history of the ICVA and context as to how the ICVA was established and how the council has evolved over time, as well as the evolution in data that is now provided in the ICVA biennial reports. The duty of the ICVA in summary is to identify the needs of veterans, servicemen, and servicewomen, including the needs of their family members, to develop and disseminate best practices for improving outcomes for those individuals through policy recommendations at the state and local levels, and to also foster the development and dissemination of and policy to aid in improving those outcomes. The ICVA was first established by Governor Sandoval's Executive Order 2012-15 and then codified in NRS 417 by AB 58 during the 77th legislative session in 2013. When the ICVA was codified in 2013, the council was required to provide an annual report. However, it wasn't until the 78th legislative session in 2015 that NRS was amended through AB 62 and AB 482, which in turn created a requirement for 14 different state agencies, as well as various regulatory bodies, to also provide annual reports to the ICVA. As a result, the ICVA provided its first Nevada's Veterans Comprehensive Report in 2016 that synthesized the data and information provided by those specified state agencies and regulatory bodies. And then the report grew from less than a dozen pages to well over 100 pages in length. The 79th legislative session brought more changes to the ICVA through the passage of SB 137, which required those identified state agencies and regulatory bodies to use specific verbiage when collecting data from a veteran, such as asking, quote, "Have you ever served on active duty in the armed forces of the United States and separated from such service under conditions other than dishonorable," unquote. And other verbiage as well, specific to those who may have served in the Guard or reserve component. In my opinion, this was a very important change, as still to this day, unfortunately, I encounter veterans have interactions with them who do not consider themselves to be a veteran due to not having served in combat or other misconceptions of who meets the definition of being a veteran. Additionally, in 2017, the Division of Human Resource Management was added to the ICVA as a council member, and I have been directly involved with the council since that point in time as the designated representative for my. Also, AB 19 amended NRS 417 reporting requirements for the ICVA from the submission of annual reports to biennial reports on even numbered years. Finally, more recent amendments were made through NRS 417 or in NRS 417 during the 82nd legislative session through the passage of AB 36, which further streamlined reporting requirements to the ICVA and also added the Attorney General, the Superintendent of Public Instruction, and the Executive Director of the Office of Workforce Innovation as council members, which brought the total number of ICVA council members to 14. As prescribed in NRS 417, the ICVA submits a report concerning the activities of the council during the 2 preceding fiscal years to the governor and the director of the LCB on or before February 15th of each even-numbered year. Additionally, the report includes information that is synthesized and compiled pursuant to NRS 417 reporting requirements, as well as any council recommendations. NRS 417.0194 specifically identifies the state agencies which are required to report various veteran-related information no later than November 30th to the ICVA. Currently, there are 14 state agencies that are identified in this section of NRS 417, as hopefully you can see there on the slide. And reporting requirements are also specified for each regulatory body from which veterans and service members have either applied for a license, been issued a license, or renewed a license with. Current consideration is also underway with the council's newest members regarding veteran-related services and programs that fall within their purview, for which new data reporting requirements may be beneficial. And I anticipate that a recommendation of new data reporting requirements for those offices may be provided by the ICVA prior to the next legislative session. The ICVA's 2024 biennial report is a comprehensive report with over 50 pages of information, which includes recommendations by the council, highlights of state of Nevada programs that directly support veterans and their families, as well as an extensive data report summary of the information provided to the ICVA for the 2 preceding fiscal years. Since the ICVA was created, the council has provided many recommendations over the years, which have been adopted and enacted through statute and regulation. The most recent adopted recommendation was the allowance through regulation of up to 96 hours of paid administrative leave for new veteran employees in their first 12 months as a state employee for any service-connected healthcare services, appointments, or evaluations. Other notable ICVA recommendations that have been adopted was the creation and codification of the Nevada Transition Assistance Program that is designed to augment federal military transition programs with state transition information and resources. The creation through executive order of a veteran networking group for state employees. The vast improvement of veteran hiring preferences through NRS 284 for state employment, both for external and internal veteran candidates, and the creation of a veterans unit and program at the High Desert State Prison. In total, the council provided 21 different recommendations in the report, with 5 of the top 10 recommendations focused on occupational licensing, licensure requirements, and reciprocity for military members, veterans, and their spouses. The top recommendation of the council in the 2020 is to codify the state of Nevada's veteran hiring program and veteran peer mentor program in NRS to ensure long-term sustainability of state workforce development initiatives and employment resources for veterans, state employees, and military spouses. This recommendation was also identified as the second highest priority item by over 120 participants who represented 16 different veterans organizations at the Veterans Legislative Symposia held earlier this year. The remainder of the report consists of highlights of state agency-specific programs for veterans and family members, and also includes the synthesized data for the past 2 fiscal years as required in NRS 417. Madam Chair, this concludes my presentation, and I'm happy to answer any questions that you or the have. Thank you.
Thank you. Committee members, questions? Assemblyman Silva?
Thank you, Chair. Thank you, Mr. Williams, for your awesome presentation. Just a quick question. I just wanted to, again, get, on the record, I know you touched upon it a little bit. Tell us why it's so important to codify the state's veterans hiring program. Thank you.
Doug Williams for the record. So our state of Nevada hiring programs actually existed since we stood it up in 2016. So it's been around for quite a while. We've serviced literally over 10,000 veterans. We've assisted with employment and connection to other sources here in Nevada. And the codification of that will just help ensure that long-term sustainability, regardless of any other changes that may go on in administration or otherwise, that those programs will be codified and continue to be there as a resource for veterans in Nevada and veterans that are coming to Nevada seeking employment and trying to build their network here.
Additional questions? So I have a couple here. Well, basically it's one, but I continue to get questions about NRS 417. And that bill was passed, I want to say it was 2019. It was a bill that I carried to make sure that the Department of Veteran Services had an outreach person that specifically looked for veterans who were discharged under DADT. And if that was the only reason that they had, other than honorable, they could get their 214, DD 214s upgraded. I'm not sure right now that that is happening, but I believe that that is something that should happen. And I would respectfully ask if you all would make sure that that is something that the ICVA follows as well, because DADT destroyed a lot of people's lives. And for no other reason than the fact that they were a member of the LGBTQIA community. And it was President Obama, I believe, in 2012 that had the executive order. And we followed up here in Nevada to make sure that that was happening. Because that, as you know, that can be the difference between getting a service-connected medical issue resolved, the difference between getting access to the GI Bill for education benefits, VA loan, and all sorts of things. And so that is very important. And I'm not clear. I know under the previous administration, the previous director, it was basically shelved, but that's not, the NRS is still there. And so that is a requirement to happen. And I want to make sure that that is something that is a priority as well. And I was looking at slide number 2, where you talk about see here. Here we go. Duties number 1, 2, 4, and 6 that I think that would fall specifically under. And so I'd like to make sure that that is something that you're following, and also encourage you to add that as part of any presentation that you give, so that the legislature knows that this is indeed a statute that's been following. When the statute passed, it wasn't a suggestion. It was actually a command. So if you can make sure that that happens, I certainly would appreciate it. And if there's any way to get a response, I know if you can't get it to us today, if you could just get it and get it to me, and I'll make sure that the other committee members get it. But that is something that is near and dear to my heart. Okay.
Doug Williams for the record. Absolutely, Madam Chair. I appreciate that.
Thank you.
I'll certainly circle the wagons on that and get you a response. And as you know, of course, the director of Nevada Department of Veteran Services is a member of the ICVA and is currently serving as our vice chair.
Yes, I know. And Colonel Devine is good people. And I know she's just starting, but I want to make sure that that doesn't fall off the radar, because I have had a couple of veterans who are in that category and are trying to figure it out. And I said, you shouldn't be trying to figure this out. This is something that is required by law. And so I sent them right back to the Department of Veteran Services. But if I have people asking me, that means that the outreach is probably still not there. And if they have someone in that position, we need to make sure that they understand what is supposed to be happening so that it does. Okay? Thank you so much. Members, additional questions? No? Seeing none? Thank you. Okay, we are moving through our agenda. We're on agenda item number 8, our work session. And members, you should have the work session documents in your folder. It is posted also on the committee meeting page. So this list of possible actions refers to senior citizens, veterans, and adults with special needs, proposals to assist seniors with dementia and their caregivers, support services for veterans, and proposals to assist vulnerable adults. The purpose of the work session is for the committee to decide which legislative measures, if any, it will request for the 2025 session of the legislature. And staff has assisted in preparing the work session documents to help guide us through the work session. The document contains a combination of recommendations based upon testimony heard by this committee throughout the interim and recommendations from stakeholders and committee members. So with that, let us begin. So the recommendations outlined in the document are not necessarily set in stone, and if the committee is so inclined, recommendations may be amended prior to the vote. And staff will guide us through each of these items and documents, and there will be an opportunity to discuss each item, and then if they're so inclined, we will accept a motion to approve them. And so I will ask our very able policy person, Ms. Cooper, will you please walk us through the document?
Destiny Cooper, Senior Policy Analyst with the Research Division of the Legislative Council Bureau for the record. As nonpartisan staff, I can either advocate for or against any measure that comes before this committee today. I will provide a short overview of the work session document. While the work session document is designed to assist the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs in determining what actions it wishes to take, each item in this document may be subject for further discussion, refinement, or action. As a reminder, the committee can recommend drafting either bills or resolutions, send letters to request certain action, and request to report back to the committee during the next interim, or put a position statement in its final report. With that, I will now walk you through the first item on the work session document. As briefly mentioned before, the Chair and Legislative Council Bureau staff have prepared this work session document to assist the committee in determining which legislative measures it will request for the 2025 session of the Nevada Legislature, as well as other actions the committee may endorse. The work session document contains a summary of recommendations presented during public hearings through communication with individual committee members or through correspondence submitted to the committee members or staff. The members of the committee do not necessarily support or oppose the recommendations in this work session document, and the committee staff has compiled and organized the proposals so that the committee members can review them and decide whether they want to accept, reject, modify, or take no action on the recommendations. The work session document groups the proposals by topic, and they are not preferentially ordered. Pursuant to NRS 218D.160, the committee is limited to 6 legislative measures, which includes both bill draft requests and requests for the drafting of resolutions. The committee may vote to 1, send as many letters of recommendations of support as it chooses, and 2, include as many statements in its final report as it may choose. Committee members are advised that the LCB staff, at the direction of the chair, may coordinate with interested parties to obtain additional information for drafting purposes or for information to be included in the committee's final report. With that, I will move on to section 1 of the work session document, proposals to assist senior citizens with dementia and their caregivers. Request the drafting of a bill to require the Department of Health and Human Services, the University of Nevada, Reno School of Medicine, and the University of Nevada, Las Vegas School of Medicine to establish a system of care for the diagnosis and care of Nevadans with dementia called the Nevada Memory Network. In establishing the network, these entities will A, contract for the services of memory assessment clinics. Clinics would expand capacity by hiring or contracting with neurologists, neuropsychologists, and geriatricians to perform the duties prescribed in the request to diagnose dementia in patients referred by primary care providers, create plans of care, and train primary care providers in the screening for and treating dementia. Clinics will use telehealth where appropriate to perform these duties for patients and providers in rural Nevada. B, employ or contract with 4 community health workers that specialize in dementia to perform the duties described in the request to provide care coordination and referrals to community-based services and in-home care, monitor the well-being of care providers, and provide support to care providers, including respite care. In addition, this bill will require the Aging and Disability Services Division of DHHS to establish and administer a program for dementia care specialists in the state. The program established will develop and provide crisis intervention services for persons with dementia and their families and caregivers, including without limitation, services that provide an initial crisis response, crisis stabilization, and long-term care for persons with dementia who exhibit behavioral problems. And B, proactively support persons with dementia and their families and caregivers to ensure the highest quality of life possible and to enable persons with dementia to remain in their own homes or with family and avoid placement in a facility for long-term care by without limitation. Subsection 1, providing assistance, education, information, and support to people with dementia and their families and caregivers. facilitating the development of communities in the state where people with dementia may remain safe and active, providing training to governmental agencies and nonprofit organizations that provide services to people with dementia, and raising awareness and developing community support for the people with dementia and their family caregivers. This recommendation was proposed by Benjamin Challenor, Nevada Director of Public Policy, Alzheimer's Association, based off the testimony provided during the committee meeting on February 14th. With that, I will pass it back to the chair.
Thank you, Ms. Cooper. So are there any questions or comments related to recommendation number 1? So then I will entertain a motion to pass.
Motion to pass.
I have a motion from Vice Chair. Do I have a second?
Second.
I have a second from Senator Dondero Loop. Any discussion? All those in favor, aye. Aye. All those opposed, nay. Who said aye? Okay, so I heard an aye, but I don't know who that is. So we have an aye from Senator Dondero Loop, Spearman, Vice Chair, and Assemblyman De Silva. So the ayes have it. Thank you. Ms.
Senator Spearman, I also said aye. This is Senator Krasner. Thank you.
Okay, I didn't even know you were here because we're expecting you down here today. So, okay. So you are not here, you're up north, but you're not in the building?
No, I'm up north on Zoom. I had to work today. Sorry. But I'm an aye on this.
Okay, I'm sorry. I did not know that beforehand. So let's move on to recommendation number 2.
Recommendation 2 we already took a motion on that. So we will move forward to recommendation 3. I just want to clarify that the topic has changed and we are now in support of services for veterans. Subsection 3 says request the drafting of a bill to A, allow Nevada-based business preference and the veteran preference to be stacked, and B, remove the inverse preference from subsection 2A of NRS 333.3354. This recommendation was proposed by the Purchasing Division of the Department of Administration based on testimony provided during the committee meeting on April 30th. Passing it back to the chair.
Thank you, committee. Questions? Comments? No. Okay. Entertain a motion?
I'm happy to make a motion to pass.
I have a motion by Vice Chair. Do I have a second?
Second.
Second from Senator Dondero Loop. Any discussion? All those in favor of the motion before us, aye. Aye. Opposed, nay.
Aye.
And the ayes have it. Number 4.
Item number 4, request the drafting of a bill to create a state holiday recognizing National Women's History Month. The holiday will occur in the month of March as declared by the United States Congress. Recommendation proposed by Chair Spearman and Kelly Guidry, Chief Executive Officer, Forgotten Not Gone, in response to the committee's solicitation of recommendations.
Questions? Vice Chair.
Thank you, Chair. I do have a question. It feels like there's one word missing, and I believe that we discussed it was about Women Veterans History Month.
Yeah, you're correct. And let's make a change to that. So it would be National Women's Veterans History Month. And just a point of information, women veterans are the fastest demographic in the veterans group. So I think this is apropos, and many times the service of women veterans is overlooked. There was a veteran, 102, who just did a tandem jump. I think it was Saturday, and she was a veteran that served in combat in World War II. How about that? So for those people who are worried that women, because of the Equal Rights Amendment, might have to go to comment, oops, too late. Okay. All those in favor, aye?
Aye.
I entertain a motion. I got confused. I will entertain a motion.
I'd be happy to make that motion with the current change to add veterans into the proposal that we have.
Second. Have a second. And so now, Ms. Cooper, can you read the,
You want to take a vote?
yeah, let me read the amendment. Yeah. So the additional wording was for women veterans. Okay, we're okay with that. All those in favor of adding the women veterans? Aye. Aye, okay.
Aye.
The ayes have it. Okay.
Item number 5, request to send a letter to the Nevada's Department of Veterans Services and Nevada's Housing Division to encourage housing units be dedicated specifically to veteran women for mental, physical, and emotional health purposes. Recommendation provided by Sergeant First Class Dixie Thompson, Women Veterans of Nevada, based on testimony provided during the committee meeting on March 26th.
Committee members, any questions? And I believe we had a bill, Senate Bill 363 last session that passed and was signed, and that would allow the Department of Real Estate to prioritize grants for women veterans, for women who are formerly incarcerated, for women who are survivors of domestic violence, and women, senior women who were housing insecure. And I believe during our meeting, I indicated that there is one woman veteran can fit all 4 of those categories, specifically because of MST, military sexual trauma, which is really just a fancy way of saying that they were raped while they were in the service. So, any questions or comments? I'll entertain a motion.
So moved.
I have a motion from Assemblyman De Silva. Do I have a second? Second. I have a second from Senator Dondero-Luke. Further discussion? All those in favor, aye. Aye. And the aye.
Aye.
All those opposed, nay. And the ayes have it. Moving now to item number C, proposal to assist vulnerable.
Item number 6, request to send a letter to the Director of the Legislative Council Bureau to encourage signage for accessibility resources such as hearing devices, seating arrangements, etc. within the legislative buildings to increase access. Recommendation proposed by Chair Spearman and Catherine Nielsen, Executive Director, Nevada Governor's Council on Developmental Disabilities.
And this is something that's been a long time coming. I know that I worked with Ms. Erdos before she left. It's something we don't have, and it's not just hearing, but we also do not have access for those who are sight challenged or blind in our facility. I'm glad we now have a handicap ramp that is ADA qualified. I'm going to ask if we will include those who are sight challenged and blind to this as an amendment, because I don't think we can work with one group of disabled citizens and constituents and ignore another. So that would be my recommendation. If we can just amend it to include those who are sight challenged and blind, I'll entertain a motion on that. Yes, please comment.
Thank you, Chair. Given a lot of the testimony that we've heard this morning, I think it would also be wise for us to include the direct feedback with regard to accessibility for people who are deaf or hard of hearing. And then we also have folks who have physical barriers. I think it's also important that we acknowledge with our Legislative Council Bureau the good work that they are doing and the strides that they've made in improving accessibility. I think we've seen that play out here today, specifically with regard to closed captioning. And so I think that it's important that we continue to recognize the good works being done. I understand we have 2 staff with the Legislative Council Bureau who are now 100% focused on ADA and the compliance and then moving us forward. So I think it's important that while we're asking for specific considerations, that we also call out the good work that's being done.
Thank you, and I appreciate that. I know we're talking about sight and hearing, but there was another meeting that we had where, and I believe in this meeting, there was a young woman who is on the autism spectrum And one of the things, and I'm not sure how we word it, but it would be to encourage more education for people understanding the disabilities, particularly those who are on the autism spectrum. And I was reminded last week as I watched Governor Walt's son, Gus, who gushing with pride, and I understand he's on the spectrum and he has limited language. And so to see him verbally acknowledge how emotionally engaged he was with his father, I think that was very touching. I'm not sure there was a dry eye around me, but it's those types of things that for people who are either unaware because they are unaware or unaware because they don't want to know, and they make fun of them or make light of their condition. So whatever we can do, and I'm not sure how to word that in this letter, but I think that it's important for us to make sure that we're at every turn. And as you said, Vice Chair, LCB is doing a lot. We've made a lot of strides towards becoming more perfected, if you will, in this area. We're not there yet, but we're still continuing to strive towards that. But at every turn to make sure that there is education amongst staff, legislators, and anyone else who might come in to contact. And it was a bill that we had, Vice Chair, last time, the state as model employer. And that is something that we should probably make sure is in this letter so that we're not creating laws. They go into the NRS, but they might as well go into the abyss because no one is paying attention and they're not enforced. So along with what we're talking about here in to assist vulnerable, I'd like us to talk about education for people with cognitive disabilities and make sure that as a state, everywhere that there are employees that people that are employed by the state, make sure that there is some type of education, ongoing education, to make sure that people understand what is happening and that these individuals deserve the same amount of respect as those who may not be challenged by these difficulties. So I'm not sure how to exactly phrase that, but if we've, yes, sir.
I will take a stab at that if you would like. I would move that we send a letter to the director of the LCB to encourage signage for all of those who have accessibility issues, to include all of those that are under the Disabilities Act. And rather than including such as hearing devices, rather than specifically calling that out, I would just suggest that we just do that broad under the Disabilities Act, and also to include continued awareness and access to any information for the legislative buildings and the legislative staff. And there's probably needs to be refined a little bit, but I think that might cover it.
Thank you. And that's said more eloquently than I did. And I'm not sure, and I just asked, I don't know if the bill only called it same, state as model employer. I don't know if there were any reporting requirements under that, but if there were not, we certainly need to look at that as probably as a BDR. So that it doesn't escape us. State as model employer requires the state to do as much as we require private employers with respect to hiring, making accommodations for those with disabilities under the ADA. So with that, let's take, I want to take a motion for the verbiage that Senator Dondero Loop provided for us. Is there a motion?
So moved.
You have a motion.
Second.
Okay, second motion by Senator Dondero Loop and a second by Assemblyman De Silva for the discussion. All those in favor, aye.
Aye. Aye.
Opposed, nay. And the ayes have it. Thank you.
Item number 7, request the drafting of a bill to amend Chapter 118 of NRS to include that landlords and real estate management companies must be willing to rent and sign residential leases with corporations if the business of the corporation is to assist people with disabilities to obtain community housing. If a corporation applies for an available rental property on behalf of an individual with a disability and is denied tenancy, a written explanation of denial must be submitted to the applying entity, ADSD, and the Office of Ombudsman for Owners in Common Interest Communities and Condominium Hotels within 7 days of the decision. Landlords must be subject to fines or additional penalties if a written denial is not filed within the set timeframes. Landlords who are unwilling to rent to disabled individuals or to companies who support disabled individuals will be subject to all applicable legal penalties related to Chapter 118 of the NRS and the Federal Fair Housing Act 42 U.S.C. 3601 of 1968, and the recommendation was proposed by the State of Nevada Association of Providers.
Thank you. Discussion? So the last part there was, that comes under the Equal Housing or the Fair Housing Act? Okay. Right. Can't believe some people are trying to avoid that, but anyway. Further discussion? I just want to add this as a matter of record, and I always say that these challenges could happen to any of us at any given time, and I know that there are members of our veteran community who went into combat fully abled and came back and they were disabled. And so whenever this happens, people deny commercial space or opportunity for people who are trying to find housing. I look at it with, I look at that with great disdain, because that means that there are veterans too who are not being served. That doesn't mean that it's more important for veterans, but I just want to make people cognizant of the fact that when we're talking about people with disabilities, that could be any of us. That could be any of us at any time. And I believe that we should do what we can do for the least of these. And who knows, at some time in the future, what we do for the least of these right now, we could fall into that same category. So let's have some patience, and let's have some empathy. So with that, I'll entertain a motion.
So moved.
Have a motion by Vice Chair. Do I have a second?
Second.
Second by Senator Dondero Loop. Further discussion? All those in favor, aye. All opposed, nay. And the ayes have it.
Destiny Cooper for the record. Work session document item number 8, request that we send a letter to the Nevada Governor's Council on Developmental Disabilities to encourage collaboration between the legislative branch and the executive branch to ensure accessibility for people with disabilities. Recommendation proposed by Chair Spearman and Catherine Nelson, Executive Director, Nevada Governor's Council on Developmental Disabilities.
Yeah, Vice Chair.
Thank you. I just have a chair, or a question, Chair. My apologies. This is to send a letter to the Governor's Council to encourage collaboration, but the recommendation comes from the Governor's Council. So I was just kind of curious why we're sending them a letter. I think that collaboration between the legislative and executive branch is one of the things that we're always working on. I'm not really clear what the letter's for, what it's going to do. If it's the recommendation came from the DD Council, why are we sending the DD Council a letter?
Good question, but I think when the recommendation was made, I think they were asking for formal collaboration, but you're exactly right. We should be doing that already. And if we have to say to the executive branch, this is something that you should be doing, I'm not so sure how that squares with state. Yeah, so, okay. Legal, you want to weigh in on that? We're sending a letter to the executive branch because they asked us to send a letter. We're looking at recommendation number 8 now.
Thank you, Chair. David Knopf, LCB Legal for the record. The committee is allowed to send letters for any purpose, as long as it's within the jurisdiction of the committee. This would be under the jurisdiction of the committee. If the manner by which we came to send the letter is a bit interesting. We are still fully in our legal ability as a committee to send this letter.
Okay, well, we can send the letter. And I guess the caveat could be that we were asked to send the letter so that it is clear when the letter gets to the intended recipient that it wasn't something that we thunk up on our own. How about that? Okay. All right. Additional comments? No. I'll entertain a motion. I have a motion by Senator Dondero Loop. Do I have a second?
Second.
Second by Assemblyman De Silva. Further discussion? All those in favor, aye.
Aye.
Opposed, nay. Okay. And so the ayes have it. Okay, so we are now up to agenda item number 10, public comment. Public comment. Reminder that we'd ask everyone who's going to do public comment to please limit your remarks to 2 minutes. And if someone has already said what you're going to say, ditto is perfectly appropriate. So do we have anyone here in Vegas, in Las Vegas, for public comment? See someone coming to the table. Is there anyone in Carson City? Anyone in Carson City? Okay. Vegas, please proceed.
Good afternoon. My name is Annie Alice, ANNIEALLIS. I would actually like to just say thank you to Doug Williams, and that I would like to kind of touch on a little bit about our veterans. Our veterans are in need of more services. We all know this. They are men and women that have gone anywhere across the world and have sacrificed for our great nation. Not all vets have all day to sit and beg for doctor's appointments at our VA. How can we meet them somewhere in the middle, whether it is remote appointments or other means? They just don't have all day to sit there. I urge the state to have more accessibility for those veterans who still have to go to work 9 to 5 in order to make their means. While they might be able to collect that the VA check that they might get every month, it's not enough. And I know that that's not within your realm, but make something more accommodable. I did earlier hear that they said that there's 96 hours for state employees. What about those that are not state employees? What do they get in return? How can we better serve our veteran community? There's so many loops that our veterans have to jump through to even get a combat service connection. Myself, I am a fiance to an Army veteran who was in combat twice. And it is so many loops through doctor's offices to get all of that combat service connected. So how can we better mitigate as a state to get them what they need and what they so deserve? Including maybe even ASL classes for those veterans that have tinnitus, that suffer from it, and they can't really hear and they don't sign. How can we, as a state, maybe offer low income or cheap classes for those veterans who might be interested in taking ASL classes? Thank you for your time.
Anyone else in Vegas? Do we have anyone in Carson City?
There's a couple of us in Carson, whenever you're ready.
Okay, thank you. And if there's anyone here in Vegas that would like to participate in public comment, please come forward now and just take one of the vacant chairs at the desk. So Carson City, we're ready.
Hello, everybody. Catherine Nielsen again. I just wanted to make note. Thank you so much for all of your hard work, and Spearman, for acknowledging that, yeah, we're all 1 second away from being a part of this group. And so the work is urgently needed, and we appreciate that. In regards to the work session, number 8, to send a letter to our council, I'm not sure what that is completely referring to as far as sending a letter, although we did mention to encourage collaboration between the legislative branch and the executive branch. So I'm certain that that may have something to do with that, but we appreciate the letter and we'll use it to help support any of the efforts that we come forward with. And then the last piece, I'm actually a veteran's wife. My husband served in the Army National Guard for Nevada for 7 years. And when we're talking about approving services and such, and Spearman, you mentioned whether or not they receive, active duty status.
If I can just if I can just put something on the record. I hold many titles, but in this role, I hold Senator Spearman.
I'm sorry. I apologize, Senator Spearman. And you mentioned veterans, and it's really difficult for our National Guard veterans to receive services unless they were activated for, I think it's 30 days or so. And my husband happens to be one of those veterans that does not qualify, though he spent 7 years training with the Guard. So I just wanted to make note that as you guys make any changes, to remember the Army National Guard also, or any of the National Guards also struggle to receive those same services. Thank you. And my apologies.
Hello, and thank you very much for giving me a chance to speak today. This has been a really incredible meeting to be a part of and to listen. There's been a lot of important things spoken about. My name is Grace Larkins. That's Grace Larkins, Larkins. This is my daughter, Luciana Larkins, or Lucy, my perfect girl. So I'm here to speak on behalf of Lucy and as a parent and as a friend to many other parents who are in my situation. So I'm 2 issues to speak on, and they're intrinsically linked to each other and also to much of what's been discussed today, particularly in items 5 and 6, related to personal care services, attendant care, and these special cases with some more complex kiddos that require nursing, such as my daughter Lucy. So first, in the waiver and Medicaid reimbursements for family caregivers, to be qualified as a family caregiver, we hear over and over about those populations that we may take care of, such as our parents, the elderly population, even if our spouse were to need that care. For example, I would be able to be a paid family caregiver in that situation. However, in all of the discussion, the big gap is always families like mine when we're talking about children. So that we are the one population really that is excluded from being a paid family caregiver. So until Lucy reaches adult, while she's still a minor, there's no avenue for myself or any of my friends who do have to stay home oftentimes to make any kind of a life where there's forced isolation. There's a really ugly loop of poverty that I see, and these choices that we have to live. Many end up having to use the community services in all kinds of other ways. But the most simple thing is, if we are forced to take care of our child, and I will point out, if they require skilled nursing, the shortage of skilled nurses is so great that almost nobody that I know actually receives the nursing that they have been qualified for, and their insurance, whether that be their primary insurance and Medicaid as a secondary or just Medicaid, is ready to cover, but their nurses aren't there. So there's that cycle. They're stuck at home, and that's, to me, a really egregious, heartbreaking problem that I see all over. And you see these incredible people. I will say, you know, any kind of guardian, oftentimes it's the parents and oftentimes it's mothers, and especially when you see single mothers that are stuck in this loop and they cannot work, they cannot be in the workforce, they can't go back to, you know, they can't continue their education themselves, they just have to stay home unpaid. And these particular individuals end up developing these amazing skill sets that you can't get really in.
Thank you, ma'am.
Okay, thank you.
Hello, thank you, ma'am. Yeah, no, I have to be fair. Comments are supposed to be limited to 2 minutes, and we've gone a little bit over, but if you will submit the rest of your comments in writing, we'll be more than glad to put them as part of the record, okay?
Thank you very much.
Thank you so much. Do we have anyone else in?
Yes, Senator.
Yes, and please remember, we've got two minutes, and I
Okay.
want to be fair to everyone. Okay, so thank you. Hi there.
Okay, thank you, Senator Spearman, and good afternoon, Senator Spearman and members of the committee. And my name is Mary Przinski. I'm here representing the State of Nevada Association of Providers, and our organization would just like to thank all of you, the committee members, for your work during this interim session. Your dedication, your commitment to adults with intellectual disabilities is very much appreciated. And we know it's a lot of time and a lot of work that goes into this committee work, and it's thankless, in several instances. And Senator Spearman, we'd like to thank you for your years of dedicated service to the Nevada Legislature. You've always come with a great spirit about you and a great spirit of helping others. Your time, your dedication, your commitment is really appreciated by our organization, and I know many other Nevadans. So thank you and the best of luck in the future. Thank you.
Thank you so much. I appreciate that. Let's come back down here to Las Vegas. We have someone in Las Vegas for public comment.
Sorry about that. Just trying to position myself so that I'm on the screen. How's that? Very good. Okay. Hello, everyone. Hello, committee members. I just want to take a moment to recognize you, and I'm here to stand before you today as a community member. And so because of that, I'm changing my hats. I took annual leave to be here today, so I'm here as a member of the community. So as a member of this community, as a hard of hearing person, I have a hearing loss. I have been here since 2015, and I have seen an enormous amount of heartache. I've listened to many concerns, and I have advocated for 100% of you. And you guys know that I am here today to do the same, but I want to talk about my experience as a person in Nevada. I'm a transplant from California. This is my home. This is where I live. And I am so encouraged today. I'm inspired to see that we were all able to be here. I see the support from every member of the community and from the committee. And I recognize that every comment that was made today, you have added deaf and hard of hearing needs to the bills, to the letters, to the comments, to the presentations, to the challenges. You have put that into your mindset and it is now part of your planning. So I want to thank you very much for that. That really touches my heart and brings me to tears that you have taken the time. So I don't have a grievance. I don't have feedback. I don't have anything you need to improve on. I just wanted to share my love for the effort that you gave us today, each and every one of you. Okay?
Las Vegas.
Hello, everyone. My name is Laura Fussell. I'm here as the representative of the Deaf and Hard of Hearing Commission. I work on the I'm part of this employment subcommittee. I want to thank each and every one of you for coming here and for sharing your experiences to help facilitate collaboration and have improvement within our community. I'd like to thank everyone for their hard work in investing in our future. And I know that as a member of the deaf legislation, or as the commission, the legislation will continue to work on recommendations within our legislative subcommittee and consider what we need to bring to the table and share with you as soon as we can for the next legislative session. So we thank all of you for your continued effort and your collaboration in order to continue to improve the deaf community here in the state of Nevada. Thank you so much.
We're here still in Las Vegas, and after this, we'll go back up to Carson City.
Hi, this is Shelley Freed for the record. As I had already commented this, or as we've gone through the course of this morning, excuse me, I've thought about the assisted living that has been brought up and nursing homes and home care attendants and keeping senior citizens in their home. I wanted to bring up, we have some deaf senior citizens have spoken with social workers, and they do have some kind of portal that they access, for example, for Alzheimer's, for dementia, for memory care, and for different specific types of services, but there isn't anything in the portal for deafness or deaf and hard of hearing. So I would like to make a request that we add that to the portal. So in addition to, or as an indicator, maybe some sort of way to indicate that the patient is hard of hearing in addition to whatever other things that need to be listed, so that's one of the options that they can put their deaf and hard of hearing senior citizen who needs services. And then the other thing that I wanted to add to what was brought up today is I have been to several nursing homes and assisted living, and I've requested a tour of the facility. And when I asked for interpreting services, all three refused to give me them. They told me I had to bring my own. So when I was doing research for a facility that me or a family member might have to be in, I wasn't even given services to tour that facility. So that's obviously something that needs to change.
Okay, let's go back up to Carson City.
Hi, my name is Pam Barrick, Pamberek. Thank you, Senator Spearman, for hearing us today. I am the mother of my son, Carson Barrick, who's with me now. Basically, I'd like to say ditto for what Grace Larkin said, but I also want to kind of be the example of what she was referring to as far as problems when we have the authorizations to get nursing services in our home and there's just not enough nurses. They're not being paid well enough to supply the services. So in my family situation, my son is 22. I've been taking care of him his whole entire life with the help of his father. And we're getting to the point in our age where it's getting very difficult to lift and take care of him. He does have violent outbursts that I have had serious eye injuries, broken ribs, miscellaneous, a couple heart attacks, things like that, due to having to take care of my son and not having the assistance that we need. And this has forced us to have to make the decision, very difficult decision, to look into a group home placement for our own health and safety. And had we been supplied with enough nursing services and enough support in home, or enough money as far as a host home, we are a host home provider as of right now, that I could hire people on our own, it would have made life a lot more easy, a lot more doable, and we wouldn't have the heart attacks and the, I got hit in the eye with a toy a few months ago, and it exploded my eye, basically, and I thought I was going to lose vision in the eye, and that was the final straw that we knew that we couldn't do this anymore on our own. He has multiple disabilities, and we're just getting older, and he's getting older and stronger. So I just want to put my 2 cents in that I don't know what can be done, but we need to have increased pay for nurses so that the nurses will be able to come to our house and fill the hours that we are allotted so that we can have the help that we desperately, desperately need, and not have to be forced into the position that we're in right now where we're having to put our son into a group home. So that's all. Thank you for listening.
Anyone else in Carson City? Yes.
Hi, my name is Alina Duncan, for the record. I am here as a community member, although some people in this room might have seen me interpreting. That was something that was arranged at the last minute, and I find that that does happen often. I am really, really excited to hear that there is a plan and there is what sounds like a committee or a segment of this legislative body that will be dedicated specifically and explicitly to ADA violations, because that's actually what we're talking about here, is not necessarily a law that needs to be implemented or anything that really needs to be revised. I find that when I come to these meetings, whether they be legislative, whether they be a subcommittee or a committee, it doesn't matter where I go. I do want to, my primary focus of coming here and being here, because that's originally what my plan was to come as a participant and just say my piece and hear what everyone has to say and be gone. There is a profoundly concerning attitude regarding accessibility specifically and explicitly for the deaf and hard of hearing. We as interpreters hear and see it. There's all kinds of side conversations and eye rolls and things that happen in our communities, particularly in Northern Nevada, when, there goes that interpreter again, oh, there goes that deaf person again, who's rabble-rousing. You know, I find that maybe the attitude has become such that we don't want to address the deaf and hard of hearing issues directly because they're scary. Not everyone understands them, and because people are upset. These are people's lives. These are lives of people. This is from zero all the way till people end up in hospice. And we'll be lucky if we see, you know, people in hospice advocating for an interpreter. We'd be lucky to see people in ERs and all of these different very extreme places where interpreters should already be. The budget should already be in place. The services should have already been arranged far in advance from when they are. And it doesn't seem to matter how many times we keep coming up here rabble-rousing and making people feel ultimately uncomfortable with something that I think people just don't want us to continue talking about. It's the only reason that we are is because it's still an issue. It's an issue of compliance. It's not just accessibility. We're talking about accessibility, but we're talking about compliance. We are talking about ADA rights violations because ADA has been around for 30 years. Thank you.
Thank you, ma'am.
Thank you.
Okay, yeah. I'm trying to be fair, and we want 2 minutes for everybody, but thank you so much for your testimony. You can submit that in writing, of course.
Thank you.
No, I don't see anyone else at the table up there, so we'll come back down. Is there anyone else in Vegas? Okay. Wait, this is the last person? There's one more, and that's the only one that I see, because I've asked everyone who's going to comment, please come to the chairs, to the vacant chairs. So, okay.
Okay. All right. Am I good? Okay. Hello, my name is Justin. And it was about last year I was at Henderson Hospital. And I was very, very ill for about a week. High temperature, everything. Went to the ER. They didn't have the VRI, the video remote interpreter. They didn't have a live interpreter there. I went all day. They put in an IV, told me there would be a room available. But when I was there, I thought I'd be transferred to a room, but instead I was just placed in the hallway, just on a bed, in the hallway, people walking right by me for 3 days straight. Never received a room, never received any communication access, had no idea what was going on, and I was very frustrated and isolated. I kept requesting an interpreter. When I finally got the VRI, the video remote interpreter, that was after 3 days of being in the hallway. And then the nurse would hand it to me to hold, and I had an IV in, and it was awkward, and I couldn't communicate, and then they'd leave. I didn't have like a stand to set the VRI on. I was trying to hold it while I was trying to communicate, and it was so frustrating and very upsetting. 3 days, I didn't have a shower, a change of clothes, communication, and it was a very traumatizing experience. By the time I got back home, I had called the insurance to talk about it, file a complaint through the hospital, as well as the state of Nevada disability. I had filed all these complaints about the interpreter and the other issues and have never received a response. It's been 3 months. Thank you. Okay, ooh, small. Thank you. My name is Lexi Bullock. I am a financial student, master's student at UNLV. So I'm focused on education right now. So I want to talk about a situation that happened, really it was about 2 years ago. I'm a student moving from Texas. I'm fully deaf. I require an interpreter for communication. And I moved here from Texas. And I wanted to change my IEP to go into a mainstream program. They refused. They would not change my IEP for over a year because I was moving from another state. They told me they could not change the IEP for over a year. So I was stuck in a special needs education department for over a year before I could transfer into the regular mainstream program. And that's something that we need to fix. IEPs should be able to be amended at any time. And I don't know where we went wrong with that, okay? Now I'm gonna put my healthcare hat back on. And I know someone in Carson City had talked about, we have the laws in place, but what are we going to do to enforce and make sure those laws are followed? With the front desk staff, the nurses, anyone who's involved, how do we make sure those are actually accommodated? Thank you so much for your time. Hello.
She's requested that I hold her phone for her. Is that okay?
Okay. Okay, so I recently changed my doctor to Archwell. And I required an interpreter, but was told that it is only permitted to have the video remote interpreter, and it was not working. And the office, the Wi-Fi was not working, so I had to reschedule my appointment for the next month. Then the office manager told my son, that we don't provide interpreters only, and that's a violation of the ADA law. And I had to switch back to my old doctor's office, but that is so far away from my home. Thank you.
Thank you. Broadcast, do we have anyone on the phone?
Thank you, Chair. To provide public comment, please press *9 to take your place in the queue. Again, if you wish to provide public comment, please press *9 to take your place in the queue. Caller, you are unmuted. Please go ahead.
Yes, thank you, Chair, members of the committee. Benjamin Challoner, for the record, Director of Public Policy for Nevada with the Alzheimer's Association. Apologize for not being there in person. I am technically on parental leave with Nevada's newest little lobbyist at 13 days old. And my partner might be a little upset that I'm on here and monitoring the meeting, but I just want to come on and make sure I provided a huge thank you to the committee, to staff for working with us and making sure that we were able to get the memory net reintroduced for next session, along with the dementia care specialist. I continue to look forward to working with staff and the members of the committee as they go into the next legislative session to making sure that we are able to get this passed and eventually implemented, and working with our stakeholders to make sure that that's possible. And lastly, I wanted to provide a huge shout out and thank you to Chair Spearman. You have been one of the biggest advocates that I have ever seen, whether it be in public office, and how you use your voice. And thank you for your years of service. And I know you're not going anywhere. I think the way you told me is a quote unquote retirement. So I'm looking forward to see how we will continue to see you in the future. But thank you again, Senator Spearman, for everything.
Chair, we have no
Thank you so
additional
much.
callers for public comment at this time.
Okay, thank you so much. I saw someone sit in the chair, but I have asked several times for anyone who wanted to make a comment to come forward. So I'm going to ask the gentleman 1 minute, and that's it. And no one else, please. No one else come sit in the chair, either here or down south. Anyone else who wanted to testify, I've asked several times, you come to the chair. So this is the last one, okay? This is the last one. So, and only 2 minutes.
Before we close, I just wanted you committee members to please help to just better service interpreters at the hospitals. Senator Spearman, you had mentioned, what happened to 2017? I thought we passed that interpreter for the hospital, and I am shocked as well. I hope that maybe you can speak out and really spearhead and challenge those hospitals to see why that isn't being enforced. Again, thank you so much for helping us.
Thank you. And with that, we'll close out public comment. As this is our last meeting, I'm going to ask any of the committee members if you have expressions. Yes, sir. Senator De Silva.
Thank you, Chair. I just wanted to thank you, Chair Senator Spearman, for your dedicated service to this country, to this state, to this community. You're a local legend, especially up in our neck of the woods, the north and the east. And we're going to miss you in the legislature, but I know, again, that this is just the beginning of many other wonderful endeavors of service, because your life has been dedicated to service, whether it was the armed services, serving as a president of a school board, or a leader in our state legislature. So I just wanted to thank you, Senator.
Thank you. Thank you so much. Vice Chair?
Thank you, Chair, for the opportunity.
You all are not going to make me cry, all right?
Yes, yes, that's our goal. Thank you, Chair. I do really want to ditto my colleagues' remarks, and I'm honored to have served as Vice Chair throughout the interim on this committee, working alongside you. I treasure our time together in Carson City, the bills that we've championed to support these populations that are so near and dear to us, and you will certainly be missed in this chair for sure. I'm honored to have served this interim with you.
Thank you. Thank you so much.
Senator? Last but not least, maybe, I just want to say, as your colleague in the Senate, I have never met anybody so passionate. And for those of you I know in the audience, you recognize that when she says something, she does something. And so for that reason, I respect you and hope to see you in the future in another leadership role. So thank you.
Thank you. Senator Gray.
Thank you, Madam Chair. I just want to say what an honor it's been serving on this committee with you guys. And
looking out for these populations and, especially our veteran population. So look forward to serving on it for years to come. Thank you very much.
Thank you. Senator Krasner.
Thank you. Senator Spearman, it's been an honor serving with you in the Nevada Legislature. You and I have championed and passed so many bills over the last multiple sessions in the legislature. So thank you for your service to our country. Thank you for your service to the people of Nevada. It's been an honor working with you.
Thank you. And to my colleagues, some of you I may see again on another committee meeting, but I want to thank you all and thank the Legislative Council Bureau staff. Has just been impeccable. Thank you so much. And as you know, sometimes when you're in a leadership role, it's you have a lot of hats. And so for those of you who have kind of picked up the slack for me, especially this the last 3 or 4 months when I'm traveling all over the place, I really appreciate that. And I appreciate the time that I've had here to serve. I will be going away from the active role in the Senate, but I won't be far because I intend to continue advocacy for populations such as those that we serve on this committee, and especially our veterans. We've not done enough yet for our veterans. So, and those of you who have taken time to come today and to other meetings, and those of you who have taken time on the phone and who have testified or attended virtually, I certainly appreciate that. And so with that, we will get started with what's next. Okay, and what's next right now is adjournment. We are adjourned. Thank you.